Adequate notice of this meeting of the Township Committee has been provided by a notice sent to the official newspapers of the Township, posted to the Township website, posted on the bulletin board of the municipal building, and filed with the Township Clerk as required by law on January 6, 2026. Ms. Casper Bloom?
Here.
Mr. DePiero?
Here.
Ms. Enton?
Here.
Mr. Nardi?
Here.
Mayor Dendis?
I'm here. Will everyone stand and join me for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, before we open the meeting to the public, I thank everybody for coming out. I thank everybody for their comments, their emails, and phone calls. I'd like to run this as a question and answer session today so we can get some more facts out on the record. I invited members of Lambertville to be here to answer some questions that aren't for me to answer as far as billing and response times and what this picture would look like should the township go forward with this ordinance. I'm going to open the meeting now to the public for comment, but I need to keep it orderly. All right, we have 5 minutes a person. We're going to try to engage in some question and answers, but it has to be respectful. And if the committee don't answer the question immediately, we will get you an answer. Okay? Before we start that, though, I'm just going to read a brief statement to remind everybody why we are here. All right, here's the question that East Amwell residents need to ask themselves. What are we going to do if neighboring rescue squads stop providing routine mutual aid to East Amwell? This is no longer a hypothetical question. As of June 1st, 2026, one of our neighboring rescue squads is no longer providing routine mutual aid in the East Amwell because providing routine mutual aid was not sustainable for them. On July 7th, our other partner also informed us and the board of directors of the Amwell Valley Ambulance Corps that the current arrangements is no longer sustainable and they want to revisit that agreement. So we had a meeting with them. For years, East Amwell has increasingly relied on neighboring rescue squads to respond to ambulance calls when AVAC was unavailable. The Township Committee must now plan for the possibility that this safety net may no longer exist. Residents should ask AVAC what their plan is to provide 24/7, 365 days of coverage without relying on routine mutual aid. A plan that is sustainable and affordable for Township residents. We have worked with them for over 3 years to develop a sustainable plan without any meaningful progress. We have had discussions with neighboring towns about merging services, but as of today, AVAC has had no meaningful conversations with those agencies. The Township Committee cannot force a merger. AVAC is not under the supervision of the Township Committee. The only role the Township Committee has in the capacity is to decide who provides primary ambulance services in East Amwell. So again, I ask the residents if AVAC is not able to provide services 24/7, 365 days a week, and our neighboring rescue squads are unable or unwilling to provide routine mutual aid to cover more than 50% of the calls in East Amwell, what are we supposed to do? The discussion that follows is about making sure when someone in East Amwell calls 911 for a medical emergency, an ambulance is available to respond. The Township Committee has one responsibility above all others when it comes to emergency medical services, and that is to ensure every resident has access to a dependable ambulance service 24 hours a day, 365 days a year. I'm going to try to address some of the questions that were posed to me and some of the things that I read online. I can't address them all because some of them were just not even rooted in reality. All right, neighboring rescue squads are required this is one of the myths that was put online. Neighboring rescue squads are required to continue to respond into East Amwell. That is not true. Mutual aid is a voluntary and depends on agreements between emergency service providers. No rescue squad can be required to routinely provide ambulance services to cover another community indefinitely. Mutual aid is intended to be a professional courtesy, not a long-term operational plan. The question residents should ask, if neighboring rescue squads are no longer able to or willing to provide routine medical aid, what is the plan to ensure every resident in East Amwell receives timely ambulance service? Another myth that was online, paying AVAC members to staff the building will solve the ambulance coverage problem. The fact is, East Amwell responds to approximately 350 calls in East Amwell a year. It may be more, you guys can correct me, but that's the number that I have seen. Transitioning to a paid staffing model requires significant financial commitment and a long-term funding plan. Providing a fully staffed ambulance crew 24 hours a day, 365 days a year is estimated to cost approximately $876,000 in staffing expenses alone. I used $100 an hour for 2 EMTs, and that does not uncover, that would not include any kind of capital improvement or any kind of repairs. Okay. The important question residents ask, where will the funding come from, and what is the long-term plan to sustain that expense? A reliable emergency medical system requires more than identifying the need for additional staffing. It requires a complete operational and financial plan that could be maintained year after year. To give context to that number, the entire township budget is only around $3 million. Another myth online, switching primary providers will increase ambulance response time. The response time information has already been presented in prior township committee meetings. Residents are encouraged to review those public records and make their own informed conclusion based on the facts. I believe you'll see those response times are very similar. I highlighted the record that was entered here a year or so ago. The average response time from Amwell Valley was 11 minutes and 12 seconds. From Flemington Raritan was 11 minutes and 13 seconds. And from Lambertville, it was 13 minutes and 53 seconds. And for the medics, it was over 21 minutes. So these are records that came from dispatch. These were offered by Flemington Raritan at a prior township committee meeting, and they were entered on the record multiple times. Switching primary providers will increase ambulance response times. We just talked about that. Response time information has already been presented. Myth, Lambertville, this is another thing that was brought to my attention. Lambertville New Hope Rescue Squad cannot adequately serve East Amwell because they already serve other communities. The fact, Lambertville New Hope Rescue Squad operates a professional EMS system serving multiple municipalities. How they recruit, schedule, staff, and deploy ambulances is the responsibility of their leadership. The township negotiated agreement only after receiving assurances that they can provide dependable 24-hour, 365 days of coverage. In addition, Lambertville New Hope has offered to welcome qualified Amwell Valley members who wish to continue serving East Amwell and surrounding communities. This allows experienced local volunteers to continue serving our community while being part of a sustainable EMS system. Another thing that can continue to come up online is ambulance billing is going to hurt residents. The fact is, billing insurance for ambulance transports has been standard practice throughout Hunterdon County for decades. All professional ambulance providers use this model, including agencies that have been providing ambulance service in East Amwell for decades. Question again, every resident should ask. If you were responsible for making sure an ambulance arrives when a resident calls 911, how would you provide that service and how would you pay for it? Identifying problems is easy. Leadership requires finding a realistic solution. The township responsibility is to provide a plan that answers two critical questions. How will East Amwell provide reliable 24/7, 365 days of ambulance coverage? And how will that service be financially sustainable for taxpayers? The proposed partnership with Lambertville New Hope Rescue Squad provides answers to both of those questions. It provides professional ambulance service 24 hours a day, 365 days a year, a sustainable operation model, a predictable staffing, a responsible cost to taxpayers, and an opportunity for qualified Amwell Valley Ambulance Corps members to continue to serve East Amwell. This recommendation is not about choosing one organization over another, nor is it about overlooking the many dedicated volunteers who have served the community over the years. Their service and commitment deserves our sincere gratitude. This decision comes down to one question. What emergency medical system gives East Amwell residents the greatest assurance that an ambulance will be available when they need one? After carefully reviewing the facts, meeting with both organizations and examining response data, and considering long-term sustainability of emergency medical service, I believe the proposed partnership with Lambertville New Hope is the best path forward for residents. Reasonable people can disagree, and I respect those different opinions, but doing nothing is also a decision, and I do not believe continuing to rely on a system that depends on mutual aid to answer most of our ambulance calls is a responsible option. My commitment has always been and always will continue to be making decisions based on what is best to protect the health and safety and welfare of the residents of East Amwell. The meeting is now open for comment. Any members of the committee have a comment?
No, I'm open to hearing from if any members of the public have something they wish to say.
Well, if I may call on Lambertville, can you, is it possible for you guys to discuss what your billing procedure is? Is somebody available to talk about that a little bit to the public?
Of course.
Okay.
Let me, just, I guess I'll stand sideways since we're doing.
And if anything I stated in here,
Yeah,
Kevin, it is not,
Use the mic.
if it's not factually accurate, please correct me. I'm doing
Sure.
the best information I have I'm working with.
Kevin Snyder, Chief of Lambertville Ambulance and Rescue. I also have here with me tonight President Lisa Aaron, Deputy Chief Austin Sorrentino, and our Business Administrator Shirley Skillman. So we brought different facets of organization so we could answer questions, whatever questions come up. But I'm going to start and let Austin, as our operations supervisor, have the mic, and he can share a lot of the data and maybe answer a lot of questions just in introduction. And then he can start and we can refer to Shirley for any other billing questions. Austin, you want the mic?
Can you just talk into the mic and just tell the
Yeah.
folks who may be at home listening who you
Yeah.
are?
So on our top level billing, Shirley can answer more specific questions. We bill a set rate of $1,300 for a BLS ambulance transport. We do what is soft billing. What's that?
Plus the mile.
Yes, plus the mileage. What's the mileage fee? 25. $25 an hour. To our knowledge, that's on average for the area. We do soft billing, so we bill the insurance company and we receive reimbursement. After that, we are legally required to send bills to the patient. We have to send 3 bills. After that, we don't take any action for anyone, right? We don't take any action on no payment received. We don't send people to collections if they don't pay the bill or anything like that. So we bill the insurance company, and what we get back is usually
In our,
what we get
in
back.
our response area.
In our response area.
So currently, is East Amwell in your response area?
They are not currently now.
So currently, if you continue the model that we've been using, you will go after people for the bill.
Yeah, well, that.
Shirley's going to answer more specific questions on about that.
Okay.
How we've been working it, if somebody's in our service.
Can you just, I know who you are, but can you just tell the
Sorry.
folks who may be listening who you are?
How we've been working it.
No,
and-
tell them who you are first.
Oh,
Sorry.
Shirley Skillman, Lambertville New Hope Ambulance and Rescue Squad, the business administrator.
Thank you very much.
I've also
Shirley.
been a member of the squad for 53 years.
Thank you.
When a patient's transported, the base fee is $1,300 for the ambulance to come, and then it's $25 per mile. And then that's how every patient is billed. Medicare doesn't pay that much. They knock it down. So a Medicare patient, our total cost that we would recuperate for a Medicare patient, around $500 per call, as long as we transport them to the hospital and they meet Medicare requirements to be billed.
Okay.
So that's Medicare. Medicaid patients, we get about $69.50 per transport. That's the state welfare, New Jersey Medicaid. Then we also have auto insurances, and they're billed the same rate. And depending on which insurance company is how much that insurance company allows for the ambulance transportation.
Okay.
Then we have private bills, and they get billed with the same rate. So once everybody's billed, and then their insurance company takes a look at it and sees what's covered and what's not covered, then our billing company, we have a billing company that handles all this because it's very, very confusing and with all the different insurance companies. We deal with over 50 insurance companies that service our residents and, auto accidents. So it's easier and better for us that we have a billing company. So the billing, everything goes to the billing company. The billing company submits all the calls to all the runs to different insurance companies. And then the insurance companies pay the billing company, pays us through the billing company. And that's how we get our funds and how we know who's paid, who's not paid, and what was paid. Most Medicare patients have a supplement. So if Medicare pays $500 and there's a $20 or $40 balance, then their supplement usually covers that. Some
people can't afford that. And after 3 billings, if they haven't paid us, but we've gotten the Medicare payment, then we write that off. It doesn't go to collection at all. There's incidents when people who have been billed, the insurance company sends the check to the person instead of into the billing company or to the squad, and then that person decides not to pay the squad. When that happens, that goes to collection for us.
So you mentioned 53 years. Thank you, by the way, for that. And for
welcome.
how many, you've been billing for 25 years now, correct?
No, we started in 2012 or
Okay, maybe that was
2012.
Flemington might have been billing for 20. All right, so when
Right.
that since 2012, when you come to East Amwell Township to handle calls and
Right.
transport,
Right.
do you bill those residents?
Yes.
What type of complaints have you received in 14 years?
The complaints would go to the billing company. If someone writes a hardship letter to the billing company forwards to us, and then we 95 to 100% of the time we wipe out the bill.
For a hardship case?
Right.
Okay.
Mhm.
All right. Thank you for that, by the way.
Right.
Appreciate it.
Is there any other questions?
Well, you got to come up and tell us who you are, address the committee, and we'll have Shirley answer. Thank you.
Hi, my name is Lisa. I'm the huntsman at the Amwell Valley Hounds, and I also reside in East Amwell Township. Thank you for having this meeting. I could be a little bit slower than some others that are here. Is Lambertville New Hope all volunteer, or do you have paid?
No, we're probably 98% paid.
Okay, all right. That was why, that's the billing then.
Right.
Okay, got it. Okay.
For a number of years, we paid staff and didn't bill. And when it got to the point where we didn't have the volunteers and we didn't have the money to continue doing that, that's when the organization made the hard decision to go to billing for our services.
Okay, got it.
Private company or?
Thank you.
Hold on, Bob. You got to come up and address us, and then we'll have Shirley answer. Mostly, we can't have folks shouting from the audience because it gets recorded and it won't be recorded. So come on up and
Introduce
um,
yourself.
but I can ask her a question. So the gentleman's going to ask: is it a private billing company, Shirley, or?
It's a we deal with a private billing company. We've dealt with the same billing company since we started billing. They've had the best billing rates for us, and they're able to bill both New Jersey and Pennsylvania.
Does that answer your question, Bob? Okay. You can sit, Shirley. You don't have to stand the whole time. You're not. You're not in like the witness box or nothing. You can get comfortable. You're just the best person to answer. The billing questions seem to be.
Well, when you've been doing it for as many years.
It just seemed to be a lot of myths and disinformation about what Lambertville bills online. And I know it's online and you can't get silly with that stuff, but folks put stuff out there and it gets folks worked up over. Okay. If there's any other billing questions, certainly you can get them to us if Shirley's not here, and I can get them answered for you guys. But I think you explained most of what happens.
If I could speak to.
You certainly can.
Just to answer the question, so we started 1986. We realized during the day that we were struggling. Nobody could come out of work. All the businesses were like, we can't let the guys leave work all the time. So we brought in 2 EMTs in 1986, and then in my early years as chief, I've been 38 years, I think. Not all as chief, but volunteering as well, and chief many of those roles. We started, we were just Monday through Friday, and then we stretched it to nights and weekends. And now, unfortunately, the reality of volunteers today, as we know, it's just hard. And, we see that. And as Shirley mentioned, we do Bucks County as well. So we have different involvements, a little bit different state protocols. Their protocol required us to be what they called zero response time or zero scratch time. And that's been for probably 15 years. We had to be in-house and in station. So that model is not new for us. We've been doing that a long time. Again, just for a little history, not to jump out. I could talk squat all night, but I don't have to.
Well, I mean, I think your record stands for itself. You've been coming here for decades, right? And you're handling about how much percentage of our calls now?
I don't have a total of what East Amwell's dispatches were. Amwell Valley.
Okay.
Rob, do you know how many dispatch you've had this year?
So there's a total of 258 calls this year. 198 of them were in East Amwell Township so far. 117 were taken by mutual aid, 81 by Amwell Valley.
Okay, and Austin, how many have we taken this year in East End?
76.
76. So again, some of those would have been Flemington as well prior to the whole thing that's going on now.
Is it still accurate?
And Hopewell, right? Hopewell as well. Mhm.
Is it still is it still accurate that Flemington is not responding mutual aid, dual alert?
I can't
any-
speak for what Flemington's doing.
Do you see them?
I think they have gone on a few calls. I don't
Okay.
know. I don't
They
know
have
what
been
they
still
go.
answering calls.
Okay.
They haven't pulled out. I know they sent the letter, but they haven't. My understanding is that's OEM, that they're not allowed to not answer calls.
Believe
They said
part-
they are,
Well, hold on. Let me just correct that real quick because I had a direct conversation with the director of OEM.
Yep.
They cannot make any of these mutual aid partners answer calls in East Amwell Township. The county policy is when let's use Amwell Valley, when they're not staffed, if you guys call dispatch, they will send the call to the next staff station. That is their policy. That does not mean they have to answer the call. All right, that just it just means the call goes to them. They can reject it or choose to answer it. So that doesn't guarantee us a response.
I do believe it depends on their staffing level of how many units they have up at one time of when they come.
It could be, but that gets technical and into the
Again,
weeds.
I
That
can't
just as
speak
a
for-
general rule,
My
it goes to the
observation-
staff station,
Right.
and they're under no obligation to answer that call. But you folks are good people. The fact that you're here, a lot of volunteers, you want to help. But currently what we're doing, based on the conversations we've had with you guys and all the surrounding towns, is not working. Is that fair to say?
So, I mean, my observation, I've probably been involved with this conversation with Amwell Valley for at least a decade with, Mikey has been part of that for a lot of it. And there's been different models and a lot of discussion and there's been plans laid out. Even the paying for mutual aid was a temporary solution, but it's not a long-term fix. And, at this point, we're just looking at the long-term fix. That's kind of what we're after here, And however we can help, we're here to provide the service. We have our service. We do it a long time. And, whatever the township decides to do, we're here either way. So.
Well, I thank you for that. I don't know. Is Amwell Valley, is Tim or Pete here, by the way? I don't see him.
Neither one are here.
Okay. Well, they were in a meeting with Kevin and I. Now, we've had a great conversation in that meeting. And I believe you graciously offered to open up the doors to qualified Amwell Valley members to become members in Lambertville. And I believe most of the active members that are current EMTs are already with you guys. Is that accurate?
We do share. Several of the EMTs are employed by us. So we do see them quite a bit. As far as the other volunteers, yes, I mean, we still do have a volunteer program. As I said, it's just difficult with the sheer amount of hours and training that is required for people to be on the ambulance. As far as the only real difference between our two squads, certification wise, is not the EMT cert, but would be there is some few other requirements for Pennsylvania. And we do a few other medications that I'm not sure if Amwell does or not. There might be some training for it, but certainly within the realm of anybody that's certified to gather these other pieces very simply. And we would help with that process by all means.
I just want to
Yeah, go
jump in
ahead.
on a couple of things quick. You referenced the names Tim and Pete. So that for the people that are just paying attention now, that's Tim Matthews and Pete Miller, and they're on the Amwell Valley Board of Directors. And I'm sure if I misspeak, Amwell will correct me. But we also, just to clarify, the mayor received an email on June 1st from Gary Brewer, who's the president of the Flemington Road and Rescue Squad, telling us that on June 30th, 2026, they will no longer be helping us with mutual aid. That's when the contract and the aid is ending with them. So we received email from them at that point on June 1st saying they were providing mutual aid on June 30th.
So that developed a sense of urgency to correct this problem because if Amwell Valley can't handle the volume of calls and Flemington was no longer helping us, that generated some concern from Lambertville, who reached out to us and said, look, we got to find a solution for this problem. I believe we found a solution. I'm one of 5. I recommend this to the Township Committee. They all will have their opinions, and they certainly all are going to have a say in it. And we want to hear from the residents, and we heard from residents. I mean, some of the comments from residents, it was just they were just simply misinformed. One thing that developed today, Kevin, and I think I asked you about this. In fact, the chief of Amwell Valley put it on social media. Does your township committee in Lambertville have a problem with you taking on this arrangement?
No, in fact, I spoke to Mayor Nowak 2 days ago, just to make sure that there was no concern. And just for a backstory, last year we were trying to help the situation by moving one of our staffed ambulances to Amwell's building, and they were gracious enough to share their building. And it did raise a little red flag because we didn't have an ambulance in Lambertville, so we had to pull that back. What there was, but in that time, we formed a monthly group between myself, Fire Chief Barlow, Chief Brown of the Police Department, and Mayor Nowak. We meet on a monthly basis just to talk about the process. Lambertville Fire Department did, since they have staff, their paid department as well, their staff does come out and help us in calls in Lambertville City. And that's just a no-brainer. They have EMTs on staff. Why not? It's a resource that's there. And if we're tied up and a little longer delayed for some reason on a response back from a call or something, they can go and start to treat. So no, we have a great relationship. There was friction again a year ago that we resolved. I've been to, Lisa and I have been to Lambertville Council multiple times. My door is always open. So no, there's no conflict there at all.
I thank you for clearing that up. Was it? Go
Yeah,
ahead.
I have a question for you, Kevin.
Sure.
So our township does Friday night in the parks, like once a month during the summer months. 4-H fair, maybe CPR training at some of the horse farms we have, things like that. Would you guys be able to cover that if we go with you?
So our current model, if we have we'll call larger standby, like Shad Festival, Pride Fest, things like that, the football games, we do bill for that service to whatever agency that is. But for community days and things like that, it may be the duty crew and they might have to leave, but we always try to be involved. And certainly CPR training we do. Yeah.
Okay.
So yes, that's no problem.
Okay.
Again, I can't guarantee that depending on the volume, but we always try to make an appearance.
Okay.
If it is a specific staffed, because I have to pay staff, then we have to charge for that.
Gotcha.
So with the
Thank
fair coming up, if Lambertville were to be awarded this opportunity, what would your plan be for the fair?
Well, this year, I don't know. I'd hope we have to work with AML for this year being such short notice. But in the long term, to me, that would be another agency where we would bill for our time there. We do have, on a normal day, the 2 ambulances staffed. So we would have another one specifically for that standby. And, so we would have resources to transport and hopefully keep one there.
Would you have any idea how many calls for service they receive at the fair?
I don't know.
Okay.
I don't know. Rob, you've been there a lot.
Every year there's a bunch. We had a cardiac past couple of years, cardiacs, broken ankles, there's tons of stuff. It's not, I love you guys. So it's not a one ambulance at the fair. You have to staff the fair. There's the truck pull, there's the horse shows, there's things that an EMT and that we do a driver needs to be at. It's not just hang at the station there and wait for the call. That's why we always put it out to other agencies to see if they want to come in also for a night, for a day. Pattenberg comes down every Friday night, helps us staff. You guys are coming on Thursday this year. So it's not, I know you're saying, and billing wise, it's up to you guys. That's through the Fair Commission. But, it's not just a one ambulance show.
Yeah, I can't speak to the fair. I've never been involved in the management side of it. For the chamber and events in Lambertville, I'd meet with the chamber and meet with whatever divisions running whatever, and we coordinate all that ahead of time.
No problem. Just trying to,
Sure. I
put it in
mean,
your
we're
put it in your
here
head.
for it. Whatever it would take, we would. I can't answer for something I've never been involved
Yeah,
in. so.
understood.
But yes, we would bill for some of that, obviously, for the time the units are there, or units there.
For example, Pride Fest, which is a pretty big event.
Sure. Yeah. Austin just pointed out Pride Fest this year is they pay us for 1 unit to be there, and I would rephrase that. They paid us for 2 units to be there. Get this right, because that does bring a lot of people to New Hope, and depending on the weather, sometimes it's temperature related heat emergencies. But we have even the Shed Fest. We have our two duty ambulances available, as well as generally a supervisor and supervisor's car there as well. So there's most time an abundance of resources in the event you need them. Now we've been blessed; we haven't needed them a lot. But Shad Fest, one year we had a lot of heat emergencies. That's usually the biggest problem. The fair, I know the fair, the county OEM and the command buses there, and there's other resources, so that would be there'd be a lot of logistics to go in ahead of time for that event.
Okay.
No doubt.
Okay. Anybody?
No one else. Yeah, you can come up to
Come
the
on up.
stage and
Thank
no, you can stand at the podium and should
podium.
really address us.
Should we
and
talking
then,
to you
yeah.
guys? Is that the deal? Hi.
That's how the cameras
Um,
are faced too for the people at home.
My question, I'm a little late to the party, right? So I don't form opinions until I know information. And I don't know enough information to even have an opinion on this subject. But my question is, okay, so now I understand Lambertville's billing policy. Does Amwell Valley Ambulance Corps, do they bill?
No, they're not able to.
Okay, so is that one of the questions that Amwell residents, or one of the concerns that Amwell residents might have is, I mean, they're kind of like already getting billed. Like, I understand that, like, if whenever Lambertville New Hope responds, I'm just, again, it's more of asking questions and thinking out loud and just trying to just understand a little bit better what the concerns might be in addition to response time.
Mike, can I respond since you guys?
Yeah,
can
go.
Yeah.
respond, just to join it. So overall, to me, it's not really different. And the reason is, what they're explaining with all the details is they'll charge insurance. So if you have insurance, they'll charge it. If you don't have insurance, they don't collect it. So you're essentially, your insurance company's paying whatever your insurance company pays. So in terms of out of pocket, you don't have it, just like you don't have it with AVs.
Got it. Thank you.
So at Anvil Valley can answer, but they do not bill. You have to meet certain requirements to be able to bill. They don't, my understanding is they don't meet that state standard even if they wanted to bill, but they can answer that question for you because you're late to the party. We've been talking about this for 4 years.
I understand
So
that. Yeah.
that has come up
Yeah.
along the way. Okay, why don't we instill billing here? And I could spend an hour explaining to you why that's probably not feasible there. So the next best thing is go with an agency that's established that can provide the service and see where Amwell Valley can fit in around that. I mean, they're welcome to join there. They're just going to wear a different t-shirt. We could talk about what the building looks like. I mean, I did ask Kevin if they joined Amwell Valley and they were able to keep their building open, could they take a Lambertville truck and sit in East Amwell? On the last numbers I had, they were there about 3 nights a week. That's not up to us if we go this way. It's up to their leadership, but he does not think that's a problem, right? As long as they meet all the requirements and there's 2 EMTs, because you have to have 2 EMTs to build. But I don't want to speak for them, but that is not off the table. That's not out of the question. So the same people that are sitting in that building could be sitting there in a Lambertville truck with a Lambertville t-shirt, still responding to the residents in East Amwell if that's their concern. The biggest problem is somebody has to pay for this. Who is supposed to be, right? So if we went with hiring 2 EMTs and let them work at East Amwell, $875,000, we have a $3 million budget, right? That's 2,000. I ran some numbers and I hate to quote numbers. That was like $2,200 a call. That's ridiculous. They're already established. They already have a base of service. They're adding more that they can handle. They'll probably have to move some staffing around, add some staffing, but it's doable. Because what's not doable is what we're doing. Hold on, sir. You got to come up to the mic, but we'll let you give you a chance. Go ahead.
So, like, what I think I hear you saying is almost a little bit of a hybrid, right? Like, if they could if they could at least on a part-time basis staff the building in our community, right? It not a complete hybrid, but I mean, just like they could be in our community at least part-time, which would have them closer to us. Like, is that what I'm hearing? Like,
You're hearing that's a possibility. But
yeah.
To be clear, we would turn it over to Kevin and his staff. They would decide what they think is best to staff. But from the conversations, we didn't just call him in 5 minutes, say this is the way to go. This conversation's been going on for years. All right.
I gather. Yes.
And then once Flemington pulled out of any kind of mutual aid, any kind of consistent mutual aid, that's now a sense of urgency. Okay, we have to do something because one of the things that comes up, okay, just pay Lambertville $200 a call and let them take the calls when we're not available. That doesn't necessarily help him because he can't prepare and plan staffing because he doesn't know when he's going to be needed. So we turn the whole thing over to him. He figures out when he thinks they're professionals. When do you think you're going to need people? They do the best they can to get it right, and they get here as quick as possible. But a hybrid, it might be the same people wearing a different uniform, but it costs about $110,000 to keep East Ammo Valley doors open right now the way they're doing it. Partially because that's like for the workers' comp and for insurance, the insurances, the maintenance of equipment. The members from Ammo Valley would join Lambertville. That would all be on his tab, right? Of course. All Ammo Valley would have to do is keep the lights on at the building. And well, again, I don't want to get ahead of myself, but I'm saying these things have been talked about. But Lambertville, another resident made something completely up that Lambertville, what did they say? Lambertville is salivating to get a hold of Ammo Valley's building and equipment. Complete nonsense. They don't want the building. They don't want the truck. They don't want any of it.
Emotion aside, right? I mean, obviously there's going to be some emotions for people that have lived there their entire lifetime. I mean, that I think is just a given. One last question, and I
Sure,
swear I
you're
will
fine.
stop.
You're fine.
What is the square mileage of Lambertville, if anyone knows this off the top of their head, and also the square mileage of East Amwell?
So when you talk about Lambertville, it's a large mailing address. In fact, parts of East Amwell has a Lambertville mailing address, including the fairgrounds. East Amwell, if my Wikipedia knowledge proves me right, is about 28 square
Okay.
miles. Lambertville City is relatively small.
Mm-hmm.
New Hope Borough you're serving New Hope Borough or surrounding? Relatively small, but the Lambertville mailing address covers a huge chunk of West Amwell, parts of East Amwell, like basically sections south of here.
Mm-hmm.
I don't know the exact house number where it cuts off, but the fairgrounds is a Lambertville mailing address, if that puts it in context. So square mileage wise, total territory, I don't have an answer for that, but in general, East Amwell is roughly 30 square miles, give or take, with roughly 4,000 people. And I know somebody on the internet's going to go, the mayor doesn't know how many people live here, how big the town is, but in general, that's the size. Oh, did that help? And in general, and again, Amwell Valley can correct me, the numbers I've been seeing in general, they get about 350, 375 medical calls in East Amwell. The squad may get more calls total because they cover a part of Delaware Township and a part of West Amwell. But in general, East Amwell is like 350 to 375. And that would be a small piece of the calls they're already handling for Lambertville.
Got it.
Okay.
Thank you.
Is that helpful?
Yes.
Okay.
Thank you.
A gentleman, you had to come up though, sir. Tell us who you are and what your question is. So you can address us and then Kevin can answer. And
No, it's more for you. My name is Patrick Beers. I live on Lindale Road.
Okay.
Been a resident for 10 years. Really appreciate the conversation, discussion. And it's really to follow up on Lisa. I'm new to the party, so don't know. I haven't been involved in all those conversations, but I thought what might be helpful as a follow-up is sort of like a side-by-side. So a way to just create an executive summary of, what the differences are that you're considering and why the recommendation's going where it's going. And I'm in no way pointing one way or the other, really have a specific question, but really understand, not only the average, but what the median is, median response time, and the high and the low. So you really get a better picture as to how things
so
are.
those copies are floating around here somewhere?
There are side-by-sides. That'd be great.
From the
Yeah.
back, yeah.
They are. Yep, there are.
Okay, then that
All right.
answers my question. Thank you
They
very
might be on
much.
the back table.
Thanks.
We can, there might be a little hard to follow because they're based on like numbers like 48, 49, 17, but we can explain it to you.
Thank you very much.
Okay. Yes, ma'am, come on up.
My name is Kathy Greek. I live on Lindbergh Road. We've been residents here almost 35 years. We've called upon the rescue squad 3 times in those 35 years. To all the volunteers here, we are deeply, deeply grateful for your service.
Thank you
This
for that.
situation has gone on far too long. In those 3 calls, one of them was not responded to. We welcome the hounds. We welcome Emerald Valley Trail. We welcome hikers. We welcome strangers walking through the property, and we have farming going on. So we have large equipment and a lot of use of our land. We came upon a rider down in the field. We don't know how long she was there. She was not on our land. She was out in the middle of nowhere, and she was unconscious at the time. One of our staff members came upon her. I received a call. What should I do? Do whatever you have to do. Call 911, and no one responded. We then bagged her up on our gator and transported her to Hunterdon Medical. She had a broken hip. We transported someone with a broken hip. We've been sued by another horse rider in the valley about 30 years ago. Welcome to the valley. They were riding through the property. They encountered something out on a trail and sued. And our property insurance had to pay for it. So we love East Amwell. We are willing to help financially and have continued to do so. We cannot give our time because we go to work to pay for our property. Please, we implore you to do whatever you have to do to provide 24/7 coverage. The discussion of what it costs to bill, thank you for all of that, thank you for your service, is ridiculous. If I need to eat, I have to pay for my food. If I need to drive my car, I have to pay for my gas and insurance. If I need a doctor, I have to pay that bill. I have to pay my insurance. Please. Thank you all. Please do something.
Thank you for that.
Thank you.
You come on up, ma'am.
Hi, my name is Jane Collins. I live on Saddle Shop Road. I have been a resident of East Amwell all my life, and I'm not going to tell you how old I am. But anyhow, as for the fair, the Amwell Valley Rescue Squad covers the fair and keeping everybody safe as, you know, when things happen. My husband is on the rescue squad. He sits at the fair in their little building every single day of the fair, along with a lot of the other members. And they've gone on many calls. We've had everything from broken bones and bee stings and different stuff like that. And they're always there to help whoever needs the help. As for my neighbor across the street, her daughter she got hurt. She tripped up her cement steps and really into her front bone. We called Troy, who is a member of the Amwell Valley Rescue Squad. He came on his own first before any rescue squad even got there. And he helped her and, you know, treated her as much as he could until the rescue squad came. And my husband, we lived right across the street from them, so we were there in a heartbeat as well. As for me, I have firsthand knowledge of East Amwell Rescue Squad on my own, because I ended up needing to call the rescue squad and ended up with open heart surgery. And I am here partly because Amwell Valley Rescue Squad came in a heartbeat and took me to the hospital. And not only that, but Lisa, who's back there, was in the ambulance with me in the back. You do not know what comfort it gave to see someone that I knew helping me in the ambulance, because I was not in good shape. But they got me there and I had my open heart surgery, and I'm here to speak of it today. So anything that this rescue squad is wonderful. They've gotten calls. My husband's jumped out of bed in the middle of the night and run there and gone out, and they do a lot for this community. They don't charge. They only deal with if you want to give a donation. They will gladly accept that. And the other ways, like we as a squad tend to do things to try to raise money. We have bake sales and this and that and the other thing, and get a little money that help. But we basically depend on donations, and we don't charge the residents. Some of the residents in East Amwell are pretty darn old, and they really don't have a lot of money, and they're not going to be able to afford any billing. So they're glad when they get cared for or taken to the hospital and they don't get a bill. And I guess that's about it. Oh, Lambertville Rescue Squad, and you're great, you're good, but you don't want to charge for each call either, you said, right?
I'm sorry.
You didn't want to charge for each call?
It's a federal law.
We have to charge for it.
Oh, okay. But you also get a donation from us to help cover
That's
part of the area. You get like $60,000 a year for what we donate to you guys because you can help us and cover the calls that we can't make or maybe are too far. And as for East Elmo being this nice little central area, if you have to wait for Flemington to come here, or even like I live on Saddle Shop Road, which is at the far end of the township, if we have to wait for Lambertville to come or whatever, people are going to die because they get there too late. And if you need something in an instant, and East Elmo is right there, and they can come really quickly, and that's going to help. So I'm maybe a little, what do you call it, jaded or not jaded, but I love the East Elmo. I love the rescue squad. I'm a member of the auxiliary, and we will welcome anybody else that wants to come and be a member, either the regular squad or the auxiliary. And right now we're like a family, and we look out for each other, and we help everybody that we can. Thank you.
Thank you for your comments. So just to reiterate a couple things that were already said about elderly residents, they typically would have Medicare if they're above 65. Lambertville only bills what Medicare takes, so nobody's getting a bill that they have to pay out of their pocket.
Excuse me, they
Go.
will get a bill, because it is the federal law that we have to bill.
Understand, right? But I think you clearly explained how that works. So,
Yeah, but what she said was they have to send a bill,
Right.
but they don't have to collect after they send
Right.
it 3 times, and they don't. That's
so, ma'am, I appreciate that's a very heartfelt story, and it's a great story, and I have no doubt that it's all true. Okay, but it does not provide an emotional story. Does not provide sustainable, reliable ambulance service. So, if my numbers are correct, because we got these from Amwell Valley, where do you have that sheet? They handled about 7. Here it is. Amwell Valley handled 8% of their calls for service last year. 92% of them went to mutual aid. All right, we need sustainable, reliable service. And I believe the month before in May was somewhere around the similar numbers. I don't want to quote numbers if I don't have it in front of me. Go ahead, just come up though with it, please.
And I just want to say too about the previous comment too, if we're worried about response time coming from Lambertville, we should be worried about it now because they're the ones responding. And from the numbers we have, nobody has died because Lambertville is responding. Their time is the same for Amwell. So if response time is a concern, if Lambertville becomes primary, it should be a concern for our residents now because Lambertville's the ones responding, and it's not been an issue.
Okay.
I'm done. Thanks, Rob.
Go ahead, Rob.
How you doing, guys?
Hi.
So I'm Rob Connor, president of Amwell Valley. So with the response times, because that's what's in my head right now, we put this out in the original bid. You know, I know you said from 2 years ago you had Oprah or whoever Oprah times, they were averages. We provided a simple Google map search. You know, there are no closer areas for Lambertville, Flemington, Hopewell, if we're staffed. And that's the key. It's when we're staffed. We're volunteers. We're not staffed 24/7. You know, it's almost impossible to do. Unfortunately,
I'm sorry to
Okay.
cut you off. How, just to clear for residents, how many hours are you staffed right now?
So currently, right now, as of the past 2 months
Uh-huh.
that Mike referenced with the 7 and 8 calls, we are Monday, Tuesday, Wednesday night, overnight shifts, 12-hour shifts.
So Monday.
Prior to that, we were Monday, Tuesday, Wednesday, Friday, Saturday, Sunday nights, 12-hour shifts. And that's when the letter first went out to all you guys. You know, that was
So
first
let me
about
just ask this question, Rob, real quick. You brought in hypotheticals. You
hypothetical what?
when you did some Google searches and random addresses.
Sure, I
we're-
went from our stations, Lambertville
Right, but
stations.
I mean,
to
those are
addresses.
hypotheticals. We're working off of calls that actually happen.
Right, you give
And,
an average.
So, but here's the question I have for you
Mhm.
and all you guys. All right, 8% of the calls, 92%
Right,
handled.
those past 2 months.
When
yeah.
Kevin walks out of here tonight and says, "You know what, Lambertville is no longer willing to do this,"
Mhm.
what is your answer to the residents?
Oh, I know. Trust me. If the
Just
OEM
give
rule
me
is
what's
that,
your answer to the residents?
Well,
What are you
I'm-
going to tell the residents when Kevin says we're going to be like Flemington and we're no longer coming?
again, I don't have an answer to the residents because we do rely. Nobody's denying that we rely on mutual aid. They know it just as much as everybody else.
Would
you
you
guys
agree
know it.
mutual aid is to help when there's overflow, or would you agree mutual aid is a business plan?
I agree with kind of mutual aid is the overflow, and for us, it's when we aren't staffed.
So it's
that is-
92% overflow.
for the past 2 months, yes, and before that, it was 50%.
Is
That you don't bring up.
50% overflow to you guys?
The past 2 years, you've been bringing up the numbers. You yourself, you guys, Dante, have been bringing up the numbers, saying 50%, 50%,
Is that
50%.
not accurate?
I'm not saying it wasn't. I'm saying those prior to the past 2 months, it was 50%.
Okay,
It went
so
to 8.
just so
Can
we're
I
cl-
finish my
Yes, go
statement?
ahead.
Thank
I'm
you.
Sorry, go ahead.
It went to 8%, which if that's the number in there, I don't know. It was 7 calls the month before. It was 8 calls last month. We changed our hours, and everybody can answer. Nobody knows when somebody's gonna fall. Nobody knows when
Totally
something's gonna happen.
understand
So it was just a bad run. Yeah, during the day things happen. On when we weren't here, things happen. When we're here, we answer everything. If we have a second call, that's where mutual aid comes to us. Just like them. If they are booked up, we answered 20 calls down in Lambertville last year, 5 or so this year. Those things are always in play.
I mean, Rob,
Mhm.
we know you're trying hard. I mean, and that's not being questioned, but what about the woman who said, please make sure you've got 24, 360.
I understand.
Hang on,
Residents.
let me hear the question.
Yep.
Please make sure you have 24, 365 coverage. And for the past 2 months, if you're saying you guys could only handle 8%, what happens? Because the mutual aid partners are not going to be doing it. We just don't have 100% coverage, right? And I know, I know that's not what you want, but it seems like the reality.
Right. I'm not denying that, what you guys are saying. We can't be there all the time. We're a small town. There's not a lot of people that like to volunteer anymore in anything. We actually ran numbers. We have 18 people out of our 50 that are actually residents of East Amwell Township. Everybody else comes from outside. That's 18 out of what? 3,900 people?
Right.
People don't want to do it anymore.
Mhm.
The people that do it because they care about their community and all that.
Right.
When it comes to the mutual aid side of it, it's we're doing what we can.
Mhm.
We cut our hours back because of injuries.
Right.
The whole thing with mutual aid and Flemington in specific, sending the letter of backing out, that was because we sent them a letter a month before saying financially, we can't continue to pay you guys. For 3 years, we've been having conversations about trying to get funding. Township denied it every year. This year, you graciously did. You offered to do it, quarterly payments. So we couldn't afford to pay
So
that.
let's not talk about that though. So if you're proposing that we give money to you so that you can hire them and they're not willing to do it in that
Well,
way,
that's
it
the
doesn't
caveat.
matter. Right?
That's the
So-
caveat of it all. If
Right,
mutual
that's-
aid partners decide they don't want to come into town anymore, there's nothing I can say.
And I can't.
That's
fault-
up to them.
I know, but they've
Yeah.
told us clearly that they can't, right? So as a township committee, we're and looking out for our residents. We're trying to figure out
Mhm.
what do we do then, because we've been patient. We've been in conversations for
We've
years,
talked for
right?
years.
With
Yeah,
you
me
guys
and
trying to
and then
figure it out.
me and Mike. Yeah.
And despite all efforts, it just seems like it's not possible for a VAC to do it.
It's not possible to become a 365, 24/7 agency
Right.
as volunteers.
Right.
The only way to do it is to have paid people on staff.
Right.
And without funding from the town, that's an impossibility.
Well,
you
with
know?
funding, with
and even the
well,
funding
hold on.
from the
With
town,
fund-
you can't afford it.
With funding from the
Yeah.
town, it's impossible.
Yeah.
It's impossible for a couple of reasons. One, the issue is not funding to get staff, right? You need to have more staff. I mean, when you have Raritan and you have Lambertville, they have huge staffs.
Mhm.
And probably because they can follow a different model. You guys have a lower level license, right? So that doesn't allow you to charge and you aren't able to bring in the body.
Well, it's just different licensing. We're part
well,
of the.
different in that.
It's different. We don't have to abide by what they have to abide by because we're through the EMS council. So
and
it's
you,
we
and
all,
so
we all
for
do the
example,
same
they
stuff.
have 2 EMTs on every vehicle.
Correct. Where
You guys
no, we don't.
can't
you
have
can't.
that.
You have 18. You have X amount of members.
But
You do what you can do.
But my point is, no amount of funding that the town could provide to
Correct.
you could allow it to work for you.
Correct.
right? And that's just because,
Yeah, because there's no way you can afford
unfortunately,
that 800,000, you know, which,
unfortunately, you guys can't get the numbers to do it, right? So, and this is why we tried to work with you guys for so long in the conversations to figure out, but it seemed for a while that didn't make a lot of sense for us to be sending tax dollars to do that when
that's different conversations.
you guys, well
that I
hear
don't
me
think are
out
for
though,
here.
because you're complaining about us not giving you money, and I'm
Well, I brought
saying
it up,
it's
yes.
irrelevant because
Yeah.
no matter how much money we could give you, you couldn't make it work because of the constraints of your structure.
Right, and that's why
your
even in our
license.
best and final, you know, we didn't ask for anything out of for Amble Valley.
Yep.
Our best and final, which I corrected that it was
I missed, so there was no intentional.
no, I corrected that on you posted something last night.
I saw it.
I just wrote
Well,
back
the
to
way
you.
I read the emails chain was it was an addition.
Yeah, it was
So
our
I
our
misread
biggest
it.
36,000 as a clear pass through.
And the email was from Pete Miller too. It wasn't
Yeah, the
between
e-
you two, just to clear up.
Oh, no,
Was it like?
yeah,
But
we were all
I
on it.
misread
Yep,
it.
we were all on it.
I
You
asked for a
asked.
clarification.
Yep.
I misread it.
And
When
Pete
Jen
was
and
right.
I
That's
went
why-
through it
that's why I
later,
just corrected it. Wasn't
I see where you're coming from, but I
Yeah.
still read it. It was an addition, but it doesn't matter.
Doesn't
The
matter.
money
It
doesn't,
doesn't matter. It was
right.
you know, we
So
did,
let's talk about money real quick. Does Amwell
Okay.
Valley have money in their treasury?
correct. We did.
Is Amwell Valley meeting all their bills right now?
Correct. Yeah.
Okay. If the township gave them any amount of money, is that going to change your responses?
Any amount of money, sure. If you want to give us any amount of money,
Well,
we can hire people.
realistic
you know,
amount
but
of
no,
money.
Realistically, no. The
Right.
township can't afford it.
Right. Well,
know?
no. Yeah,
You
that's
can't afford
realistic.
it.
We
It's
can't.
clear- that's
So
that's
let
the
me
bottom
ask you
line.
this, because I don't consider you and I have an adversarial relationship.
No, I think we have a great relationship.
Somehow, folks from the organization have painted me as this
Again,
villain
different-
here.
Yeah.
Everybody needs a villain. I have broad
Mhm.
shoulders. I can wear it. The gentleman that posted my picture, I wish he would have asked for a better picture.
Yeah, he's
I
not
could have
from our-
gave him a
he's
better
not part of our
picture.
squad, so
Well,
I
he
have-
referenced you guys as being friends with all you guys.
everybody in the town that commented on a good side referenced them as friends.
Okay.
I have no idea who that person was.
Okay.
You know, so he
It
was
doesn't
not- he
matter
was not in
because
any
there's First Amendment.
representation
People
of
are
the squad.
entitled to say
I wanna
whatever they
clarify
want.
that. You brought it up. I don't care what picture they used. This guy has nothing to do with the squad.
I didn't say he did.
Yeah,
I didn't
okay.
say he did.
All right.
My joke of it is, I wish he would have asked me for a better
Yeah,
picture. I
that's
would have given him a better picture. That's
Yeah.
all I'm saying. So let me ask you this: what is your problem or your concern with following this model when they're going to open the doors to you guys?
I never said I had a concern with that. Our thing is, you know, obviously we want to still be here for the township as often and as frequently as our volunteers can. You know, it's ebbs and flows. You know, we drop down our hours. We last 2 months had 7 new members. You know, we have 4 people.
7
going
new EMTs.
7 new members. We have 2 cadets, 4 people in EMT, and 1 that's almost cleared for a driver.
Okay.
You know, but that's the way volunteering works. People come, people go. That's what happened when me and my wife Lisa and a couple other members 3 years ago. You know, literally, all of us joined at one time. You know, and that helped boost. There's always going to be that. There's the same thing with paid agencies, and you guys will say, you know,
People come and
even
go.
keeping paid staff.
They do.
It's
Yep.
hard. They're scrambling all the time to get shifts covered. Flemington does the same thing. Everybody does it. It's just part of EMS, unfortunately. You know, my real only question here, you know, because there's not much of anything I could say to you guys that's going to change your mind. You know, I'm a resident. You know I want to make sure an ambulance comes to my house if something happens, one way or the other. My
So then
biggest
how
concern.
do you propose we do that then? Let me ask you.
My
that.
biggest concern, because I want to continue with my
Go
my
ahead,
thing,
go
and then
ahead.
you can ask me that, is I would like to know for the residents' sake, the $60,000 of the bid for the best and final. It was $230 6 months ago as their lowest bid. Let the residents know what this will increase to over the next couple of years, because it's not going to stay 60. It's going to keep incrementally going up, and eventually it's going to have to be a tax burden on the residents. They're not going to, I mean, you guys correct me if I'm wrong. You're not going to do this for $60,000 next year, or 2 years, 3 years down the line. At some point, it's going up. You know, I think the residents need to know that stuff. You know,
I mean, we are a business model.
Yeah,
As
we have great
as we know,
conversations about it.
expenses continue to increase.
Mhm.
Everybody knows that. Our goal is that that's is an entry level bid.
Mhm.
It's not going to be a substantial increase. It does depend on the funding model. Obviously, we can solicit for fund drive. And the billables, depending what those things all look like, you know, we don't know. We're going into this a little bit cold too.
Okay.
So each year we review our budget, review the expenses, and make those decisions.
But that 230 was your,
So just
you're
for,
where it
again,
would be.
some
And I'm just
history,
saying, yeah.
my gosh, probably 6, 7 years ago, Mike, we sat at a round table, Mike said, what's it cost for the staff and ambulance? I said, $1 million.
Yep.
He's like, $1 million? We can't do that. I said, I'm telling you, if you wanted a 24/7 365 ambulance in the station, it would cost $1 million. When we put the RFP in January, we really drilled down in the numbers to come up with some variety of
Right,
options.
three different, it was
Where
good.
they're staffing, where they're modeling different things and trying to be generous. And now we're at the next phase here where this includes not just the dollars, but the area and the fund run and all those things too. So there's a lot of unknowns that we will have to work with. Part of if this does go through, we'll have an agreement that'll likely be on an annual basis and it'll be reviewed just like any other contractor for the township.
And that was my only thing on that.
Yeah, and I want to say to Rob, I mean, that's a good point that I know the
mic's
town
go
is.
crazy. I can't tell this one.
Oh, sorry. No, I mean, that's a good point, right? The residents are concerned that the price will go up, but
Yeah, 'cause you see
unfortunately
online.
that happens with everything. I mean, Frank's fee goes
Right,
up
fees go
each
up.
year, you know?
Well, what
Our-
about
our
the
prof-
20% that, are benefits for our
Our
employees?
employees went up like
Everything goes up every year.
everything goes up.
Insurances go
So
up,
I mean,
everything goes up.
we're concerned about
Yeah.
that with every single service we engage in with this town, and we just
Right.
try and do what's fiscally responsible and provide the best that we can. So
Yeah, my point
you know,
was
if that
just
happens-
60,000 isn't going to stay long. At some point, it's going up no matter what.
Well, and
I figured being that they were all
even
here,
if you guys
one of
could
them would know
perform the service,
about what it
it
would
would be
be.
going up for you too, right? Because costs go up.
Sure, insurance is
And
just
so,
alone.
so Jenna's point is the fact that in our society, costs are going up and inflation goes up is not the factor that determines whether we do something. That's going to be
Same
true
goes.
for everything. So what we try to do is we get maximum grants, we try to be efficient, and we try to do that here. I mean, to me, it's, the issue of cost, if we had to just do this on our own, it would be $1 million for us to do everything we'd have to do to have our own service provided by the township. It's not practical. So we've got to look at what are the realistic possibilities. And that's why we ask for best and finals to say, look, everybody give your best, because we do have to provide more coverage than has been provided because somebody's going to get hurt. And of the options that we have, that's why we wanted to have this session to talk about, well, let's look apples to apples. Let's do the side to side comparison like he was asking, right? My neighbor was asking me.
That's exactly what I'm looking
Right?
for in the sheet.
Yeah. So when Pat asked for that, because that's where we are, we know we have to do something now before someone gets hurt. We've asked for the best. We've given everybody a real chance to do it. We even voted to, permit you guys to get a letter from us to try to get grants from the county. And
Yeah, we appreciate
assuming
it.
you get that
Yeah.
money, then you could put that in your bid because we want everybody to have a shot. But in the last analysis, we've got to do something now to introduce something that will have a decision next time, and people can come back after thinking about it. But we've got to move forward in a way that's protective. And look, you and I have talked, and I appreciate even you work hard. You guys work hard. I would hope that there's a way that because I don't see how we can, my personal opinion, how we can not accept the professional bid from Lambertville because they can do it.
I'm assuming by professional because this gets brought up all the time. They
Well,
just
well,
need to
well,
get
hang on. Professional because they've
They're
got a
paid.
large squad, they're viable economically.
We do the same
they
stuff.
But you
Yeah.
guys aren't viable economically,
No,
and
I'm
you
just
don't
saying,
have
I'm
as
just
large
saying
a
in the
squad.
sense of what our members do, our EMTs do.
No, but that's
they
different.
do the same. Professional to me, just clarify that's because they're paid.
Well,
that
professional
to
a
me is
professional
the
squad
reason it
to
gets
me
brought up a
means you
lot.
can you can handle 100% of the calls.
Yeah.
So to me,
Okay.
that's the big issue, right? We know everybody has to get trained and they got to meet standards. That's the same. But to be professional is you've got the staff, you've got the money, you've got an ability to do it. And for a number of reasons, unfortunately, your squad is hamstrung by the type of license, inability to get the volunteers and inability to
Yeah,
even
it's the volunteer
charge.
side. Yeah.
Right. And it's not your fault.
No.
So I hope that there's a way that we don't have to lose the ability to have you guys participate, your members, and have you contribute to East Amwell like your guys have done, right? And that's really important. And I think there is a way because what we're hearing is if Lambertville does it, they're open the doors. They're welcoming folks to join, do the standards, do the tests, do the strictures, and do it as well. And so to me, that seems to be the win-win because our residents are protected. We have 100% coverage, and we have all the folks who want to volunteer from East Amwell and part of your squad can do it, as Mike was saying at the beginning, in a slightly different way. But I mean, it's an important service. So
And we've had offers from other agencies to, everybody knows what's going on.
You know, Kingwood's offered, Hopewell's offered.
Yep.
You know,
I
the
just think-
members.
I just
listen,
think that would
when
be good.
when this happens, because it's not an if, we know it's a when. We've known. You know, our members know they can go down there, do what they can. They don't do the volunteer the same way. I know they're more training. That's normal.
Yeah.
But other agencies too.
I mean,
You
that
know,
it would
like
be
I
a
said, we have a
win-win.
very good working relationship. I feel we always have.
Yeah.
I think me and Kevin have built a good relationship personally. We've had a lot of late night talks, a lot of them.
Yeah, I'm sure.
Trying to move things forward.
And
you
we
know?
shouldn't lose that, right? So I mean, if you
No,
guys
no, we
have
won't.
that relationship, right, and your members are willing to do it, we're not losing as a township. Our residents aren't losing if you're still able to plug in.
The
and do it.
loss is on the days that we are staffed. There is a loss there because calls will take longer, things like that. Those
Well,
are the days,
well,
and that's something
if you
that
look at the data, you know, to me, 11 minutes and 11:53.
again,
right?
Again, miles don't lie. You know, so
But the miles do lie because it depends what miles, where is it coming, and it's
that's
not
what
a
I'm saying. Miles
hypothetical.
don't lie. you
No,
know?
they do lie. You can't do a hypothetical Google search and say the times must be when we've got data
I'm not saying it must be.
on,
I'm just,
on actual
yeah.
calls. So
I'm just saying I can Google your address from me, Flemington, Lambertville, Hopewell,
I'm going
and you
with the-
get different miles.
I'm going
That's
with
all
the
I said. That's
actual
all that.
data.
That's all that was.
We've got
That is.
years of calls, so we
Yeah.
know what the data is. We don't have to hypothetically wonder what Google might say. So
Honestly,
I-
you can show me any data you want. I know that when we're staffed and there's a call in East Amwell Township, there is only the Rainbow Hill area that Flemington is about a minute closer. Other than that, there are none. You know, so that's what it comes down to when you talk about response times.
that's not.
I'm
what
not
the-
saying Lambertville is going
that's
to be
not
an
what
hour
the data
later.
shows you
know?
guys have been providing to us when we can get it. So I would say instead
When we're
of
staffed, and you quoted our whatever it was 3 years ago, 11 minutes or something like that, and you see every month on our call data, you know, it's 7 minutes response time.
so for 8% of the calls the last 2 months, you guys think you're a little bit quicker. I mean,
I'm not saying no, I didn't say that.
well,
And I didn't say anything about the 8% of the calls. I'm just saying.
well, I'm
in
saying
general,
8%. If
right,
you're
in the
only
past 2
handling
months,
8% of the calls
in the last 2 months,
then
correct.
your argument that you're a few seconds faster doesn't
when
seem
we're staffed.
when you're
That's
staffed
all
doesn't
I'm saying
seem.
is when we're staffed.
And
I'm
if
not
you're
saying-
mostly not staffed,
we can go round and round and round.
we
don't
can
have to.
because I think you're not accepting that. You can tell me that you think it's a little bit quicker, but if you're only handling 8% of the
I can
calls,
prove it. Hop in an ambulance from their station
All
to
right,
our station. Go
we're
to
done.
I don't have to go
We're-
round and
Rob,
round with this.
Jonte, that's
Yeah,
we're done with
I
this.
agree.
well, I
We're-
was
this
trying
is-
to leave.
I know.
I was
know.
trying to
And
end
your
it
side.
with asking you to be part of a solution, but I think
I've been trying to
instead-
be part of a solution for 3 years. I've been trying to work with you
Great.
guys between funding
Great.
and everything, hitting brick walls all the way along.
So then, so
for
let
all
your
the reasons,
so let
you
your
know?
folks know.
So we
that
have,
they have
been
an
trying
ability.
to work with you guys, and we will work
So
with
let-
Lambertville. They know that.
Then that's
you know?
great. Then
So
my
you know,
my effort
Lambertville
to
has
get
always
you
been a
to-
friend of.
then
East
my
Amwell.
effort to get you still involved and your members to still be involved is a success.
Yeah.
Thank you.
Thanks.
And
Anything else,
if
Mike?
I
'Cause
could
don't
just
need
say
to
for a
keep
sec,
going
I
to
mean,
that.
we all appreciate
Thank
everything that your squad has done for this
I know you
town
guys do.
over the years. We really, really appreciate it. We are not discounting anyone's service. You are an amazing group of people. What we struggle with is that the volunteer system
It's hard.
does not work.
Yeah.
And it's heartbreaking for all
Right.
of us that it doesn't work and that you guys are willing to put in all the time and effort. But we have to look at the data and the reality of it's too much for the mutual aid. Everyone
Right,
on
and
the,
that's what
on
it
the
comes down
comments,
to.
they keep
Yeah,
saying,
and that's what it comes
do,
down to.
do mutual aid,
Yeah.
do mutual aid. We can't force the other squads to provide mutual aid. They can't do it
Mhm.
anymore. And that's really unfortunate, but this is the new system that gets our residents
Mm-hmm. Yeah,
coverage.
if other
It gets
agencies,
them the
any
service.
agency wants to back out, say, hey, we're no longer coming into a town, there's nothing anybody can do about that. You know, like you said,
No,
if
and
OEM said it's
don't-
not the
we
rules,
don't
then it's
run-
not the
We
rules.
don't run your operation.
Right.
We don't run
Mhm.
their operation. All we can do is look at the facts that
Yeah.
if we want an ambulance to come, we need a squad
Yeah.
that's going to provide by themselves
Mhm. No,
100%
trust me, I
coverage.
totally understand it. You know, like I said, my biggest thing has always been, you know, when we are staffed, we answer every call. You know, we're not staffed all the time. We're volunteers. I have a job. I literally work a Tuesday night tonight. I'm on shift. I'll work tonight. I'll get up at 6. I'll go to work. That's what volunteers do. You know, paid guys just do it. They do the same thing. They work a
Yes,
lot of hours.
Yes.
You know, we have members that are both, you know, Brian, Lisa, you know, they're both here. They work at both squads. Brian will work 12 hours there, 24 hours there, come to us, work 12 hours, get a couple hours sleep, go back. You know, that they want to do this for a living. They want to do this because they love helping people.
But
You know,
I
and
don't
they
want
all
the
will.
community to think
Yeah.
that we don't appreciate you, and
No, I know.
that's a
I
lot of
know
what
you
we
guys
get
do.
back
Yeah.
is that we don't care about the service that you've been providing. We care and we appreciate it, but we need to make sure someone's doing it 100%.
No, I understand.
And
Trust
that,
me, and I know you guys
that's
do.
that's
We've had
what
many
we're,
good
that's
talks.
what we're trying to do.
Yeah. Yeah. I
And we
appreciate that.
do. We thank all of you for your service.
Not to interrupt,
Absolutely.
but anybody is welcome to volunteer and to join us, and then we'll have more members.
It's not a sustainable. I second everything that Bev said.
I know you do, bud.
Yeah.
Yeah.
I appreciate.
And listen, we
what
all,
you guys
I like
do.
you guys, you know, I have no grudges. Mike, like I said, we've always been working good together, you know, and I get it, you know, just, you know, it's one of those things that unfortunately, you know, money is always an issue, you know, we've talked about how funding decreases through the years and stuff like that. And, you know, kind of is what it is in that sense. You know. Any other questions? Mike?
I don't have any,
Okay.
but the gentleman in the back, you're welcome to come back up. It's
Sorry, it's Patrick, one more.
Not for me, right? Or for me?
But for both of
Sure.
you, really, a thought going forward is a creative solution sometimes can come up. If the funding does go up in the future years, are there ways that, you know, through our volunteer and contributions and ways to support this in a different model that could help everyone involved? Because again, you know, it's a little different. I just don't know enough about
So
how
that's
things
up to
work.
the town.
But I just,
That's-
that's,
yeah.
it is, it's not like, hey, we're this and then done and kind of like let things go. There still could be some other creative ways.
It's
to
no
approach
different
it.
than if
That's all.
Lambertville would like to, you know, have an ambulance in, because I know part of this is, most of this is not including an ambulance in town or additional staff for, you know, the township. But same thing, you know, if we did it last year, it worked great. You know, if they do want to staff an ambulance in town, you know, that's something that we'd have to work out. We own our building, we own everything, you know.
thank you.
You know,
Yeah,
as
thank
for,
you.
as for you're saying, like, as things
That's
go
what's-
up,
yeah,
are there things that volunteer agencies can do? No, the town's on the cuff for that.
Can I ask one more question? So with respect to the fair and Friday night at the parks and those
We'll still
other
be there.
events, you guys can still do that.
Of course.
So
We're still-
you're still
our members are
around,
still
no,
EMTs, we're
because,
still
right,
part of the
we're
EMS
not, we're
council.
not,
This
everyone
doesn't
thinks
change
we're
any of that.
we're shutting you down.
No.
We're not shutting you down.
No,
You
we
can
have our
still be
standbys.
active and
Well,
provide those services.
all right. Are you shutting us down? No.
No,
But are you shutting us down? Yes. You take away our primary, that's 90% of our calls. We still have Delaware and parts of Delaware and parts of West Amwell. But honestly, they're gonna follow suit. You know, so once you have no calls, it's impossible to get members. It's hard enough right now. Thank God East Amwell's a very safe town. You know, and most of the calls, you know, bless my heart, that I've been on, have been helping me mom, you know, and I like that. You know, I don't want the bloody bones. I don't want the bloody body parts. You know, I do this because I care for people. You know, so I'm more than happy to help somebody out in that aspect. But, you know, without the calls, you're never going to get an EMT that's going to want to just sit around.
Mhm.
You know, it's hard enough now when I've been on so many shifts consecutively that 12-hour shifts over and over. For a month, I was not on a single call. It's just a roll of the dice. So once you have no territory, once you don't have that responsibility, it is shutting us down. You know, can we still staff a horse show? Can we still, if we're requested, do East Amwell's Friday night in the parks like we have? That's up to if East Amwell requests us. You know, for the fair this year, we're, you know, besides having the help that we sent out for certain days and whenever anybody wants to come, every agency is allowed to come. We offer it up. We want more people there. You know, we still plan on doing that.
yeah, I just
we're
wonder
doing-
if that's because, you know, the all volunteer model
It is, but
is shrinking.
It is, but there's no
Is
money in
that,
that. So, you know, once we lose the township, we lose all ability to ask for funding. You know, that's the only way to stay in business, to keep the lights on, you know, to pay for the medical supplies and everything. Whether you're using them or not, you still need to have them, you know, and nothing's cheap, you know? So.
yeah, I just want, you know,
Yeah,
trying
but
to
it is
think
shutting
how,
us down.
and
It
and
might-
how,
we might
but
convert
how
into a
can,
different way,
how can
but-
you become a subset of, I mean,
Well,
they've
there's
said
no,
that
there's
they
no
welcome
subset. The
you.
only way to become, and correct me if I'm wrong, to work with Lambertville, we have to join Lambertville, and it's Lambertville's decision. It's their ambulances that we would use, you know, if our members join, just like the current members are. You know,
Yeah.
they ride and they answer calls in East Amwell, they answer calls in Bucks, you know, wherever they're done. You know, but in the sense of the squad, this does shut the squad down. You know, so I wish it didn't. I wish
Yeah.
there was a different way, you know, but, you know, that's it.
So I got two residents who want questions, but let me just touch on what Bev said. So if this ordinance is introduced and if it's passed, Lamberville is going to decide who stands by where. They will no longer be a primary responding agency. If they stay as an ambulance organization, if Lamberville puts them on as mutual aid or second due, is that the right language? You can correct me. That's going to be up to Lamberville. Well, there's one driver of the car, not, wait a minute, we're at the building today, even though Lamberville has the contract, we're going to race them to the bowl. That's not what we're doing. Okay. Hold on. The gentleman had a question, then Lisa, then Bob, and then the lady behind Bob. Thank you.
Frank Greek, also from Lindbergh Road, and it's not a question, it's a statement.
Okay.
You all pay the patience of this board. Fantastic. I don't see any dictatorial rule here, but, and I hate to say it to the squad, you've done a great job, but your business model has failed. You don't have enough volunteers.
Frank, can you got to address in
Yeah.
in a Robert's rules? You got to address us.
No,
I'm sorry.
your business model is a failure. There's not enough volunteers to do what needs to be done. It seems like the professional business model is the only game in town. And if Lambertville is the best option as a professional that we have, there's really no choice. Yes, everybody has to say what they have to say. And there's a lot of things that the squad has done that we love, but there's not enough of you.
Oh, Frank,
Look, I'm
Frank,
85,
Frank,
I'm
Frank,
done.
Frank, address us, please.
I'm not volunteering.
Well, she's yelling from guns.
I know, I know.
But
I'm trying to keep some order.
if it doesn't work, it doesn't work. Then you find something new.
Thank you for that. Thank you.
Thank you.
I think, Lisa, you had a hand up? Yeah, come on up. Just tell us who you are and who you represent. We need your address. That's where you represent.
My name is Lisa Aaron. I'm the president of the Lambertville New Hope Ambulance and Rescue Squad. It feels kind of weird to talk to you guys when I kind of want to say stuff to them too. But, you know, I just want to say too, like, I am a volunteer and Kevin is a volunteer and we do still have volunteers, but volunteerism is a luxury and a lot of people don't have that anymore. And it is sad that it's gone away. But at the end of the day, we're here all for the same reason. We're all trying to help people when they need help. And we are willing, and we do invite the 48 members to come to our squad in any capacity that we can make it work. I just want to reiterate, I know you guys
Yeah,
talked
thank
about
you.
volunteerism
You
and
have
like,
made that clear.
like
So-
volunteerism, it's super important, and it's not enough to say, well, then you come join our squad now off the street, not having any experience, but they can come join us. And I know it's an identity issue. I get that. I understand that they identify with their rescue squad, and that is hard. But if we all want to still help people, we can do it together.
Yeah, thank you for that.
Thank you.
That's fun. I think Bob was next, and then the nice lady behind you. Thank you. Thank you.
Hi, I'm Bob Kramer from Van Luz Road.
Thank you.
I've been here about 45 years. So I have a bunch of questions that I was actually writing as I was listening to the dialogue between different speakers. So my understanding is our ambulance corps, we're a nonprofit 501 or something of that sort. Is
That sounds
that's
right.
true? Okay. And the cost to the residents is 110,000 a year, or that's what it costs Amwell to keep the lights burning. However, they get the money.
That's what it costs them to
That's
stay in
their
business.
expenses.
Yeah.
Okay, but we're not taxed.
The township this year was making a $25,000 donation to the
So
rescue
it was
squad.
a donation.
A
Okay.
quarterly donation.
So from our tax base,
Yes.
we send that money.
Right. Who owns the fixed assets, the real estate? Who owns the land that
The squad.
the
does.
squad? Okay. Should the dissolution or the corporation be dissolved, what happens to the fixed assets?
Well, you'd have to ask them what their.
Yeah.
That's through the ambulance corps.
All right,
Yeah.
but we as
That's
the
ours,
township,
you're-
we don't
No
own
say.
it.
Township has no say.
No say. Okay.
Yeah.
Okay, so Mayor, you'd indicated that right now the township is running on about a $3 million budget.
It's somewhere in that ballpark. Again, if you have the exact number.
that's
just-
okay. Little
It's
over it, but
Little
it's
over.
around $3
Somebody's
million.
going to be on the internet saying the mayor don't know how much
No,
we
no,
have, but it's about 3 million.
Trust me, I'm good with fuzzy math.
Okay.
But that said, bless me, I appreciate what we have and what we don't have. We really haven't had any fixed services. We don't have a paid fire department. We don't have a paid police department. We rely on the state police. And everybody in our local government, except for our lawyer, is volunteers. For the
No,
most part, right?
DPW. The DPW.
Okay,
our
yeah,
office
yeah,
staff,
department,
yeah.
okay,
Yeah, a
understand.
DPW
Okay.
office staff is.
All right. So when you'd indicated that the cost, direct staffing cost, would be somewhere in the neighborhood of $875,000.
Right.
How does that translate to taxes? What would it cost our taxes? Because those two numbers,
All right.
Yeah, so I mean, you couldn't even calculate it. I mean, typically, like if we spend, what's it, $10,000,
Mhm.
right? That is a 1% tax increase. So you could do the math from $10,000 to $800,000, and it would be so big your head would fall off.
okay, be that as it may, now
87% increase.
No, it's like 8,000%.
Yeah.
It's something huge. Right?
Okay.
Your math's really fuzzy there.
Yeah.
Sorry.
That's
I
okay.
just put it. Here's my calculator.
No,
Hello, put this on
you
camera. That's
probably
the
forgot some
calculator.
zeros.
Okay,
Yeah.
our meeting tonight is to kind of put our heads together to come up with solutions. Lambertville has
no,
made it.
actually, just so you're clear, so tonight's meeting is we've only had 2 bids, and we have the 2 that are being compared side by side. So our goal tonight is to figure out whether we go ahead and introduce an ordinance that says, given the circumstance, we believe that Lambertville is the only viable bid, and it's practical, and we could pay it.
Okay.
And therefore, a month from now, we'd come back again, and the public can come back again, and we would take a vote on whether we want to approve that ordinance.
Okay, so this isn't a yearly contract. This is just a temporary.
No, it could be a
An
yearly
interim.
contract, absolutely.
Okay.
So on a yearly basis, but we're not at the beginning of the year because this is when these circumstances have come to a confluence.
Okay.
I'm
Okay.
sorry for interrupting. I wanted you to.
Oh, no, no, look, I appreciate it. And if I may, right now, East Amwell, we cover 2 days a week? 3 nights? Okay.
So 36 hours?
36
Am I do
hours
math? Okay.
over
Math's
3
right.
nights.
Yeah.
Okay.
Unlike Mike's.
Okay, bear with me as I go through my notes. So it was already discussed if it's an indigent or an out of state or someone that's a non-resident, if they're injured on our streets and ambulance is called for.
Yep.
The residents are under no obligation to foot that bill as tax burden. Okay.
No, no, definitely not.
Okay. We all pay the 911, the mutual aid charge through our phone bills, correct? There's always a little line thing, $1.55 for 911 calls. So we're all paying something for something, right?
That doesn't have anything to do with us as the
That-
town.
yeah,
Yeah.
that's
That
a-
we don't get any of that. Yeah. That's
I don't
not
know
the
what that
mutual
is.
aid. Yeah.
Oh, okay.
Yeah, that doesn't come to
So
us.
that has nothing to do then with
Doesn't, we don't
mutual
see a dime
aid.
of that, no.
Okay.
What my understanding of that is, it's years ago when you got a cell phone, let's say you got your cell phone out of New Brunswick. If you called 911, if you were in Flemington, it would go to New Brunswick dispatch. All right, now with that new fee, it transfers everything to the closest dispatch center. That's
Oh.
generally what that fee was created for, but it could have morphed into 50 different things now, but that's generally how it worked. Having been around as a police officer on both sides of the cell phone issue.
Okay.
Okay.
Okay. So I have 2 more points and I appreciate your time. When you were mentioning that you get to bill because you're at a different level and that federal law requires you to bill, is it your training or is it the insurance that you carry, or why don't we have that same level? That if we can bring that, if we have a source of revenue, why wouldn't we want to meet that gate?
So I'll answer that from the township committee side. So there are, and generally speaking, two different types of licenses that a nonprofit can apply for to provide EMT services. The one that Lambertville has is what I call a higher level one. It requires higher level training, number of EMTs, etc. When you get that license from the state, my understanding is that you are then allowed to bill.
Okay.
And then when you do bill, they're telling me that other statutes require them to send 3 bills before they decide not to follow up. The state also has a different ability to have a nonprofit get a lower level license for EMT services. That's the one that the Amwell Valley Squad has. That one only has 1 EMT per vehicle, and it does not allow them to charge. So because they have that license and can't qualify for the higher level license that Lambertville has, they're just not allowed to charge.
Okay, but we could if we wanted to. Your organization
You can,
could,
organizations have.
and
they
then
probably
you'd
started
then
off
you'd
with
have
some
another
funds at one point.
source of revenue.
Right. It's
So because I heard your question slightly different than Bob, than Dante answered it. So there's about 375 calls that they get in East Amwell Township. They're not all billable calls. Am I correct on this, guys? It has to be a transport to be billable.
Okay.
So let's say half of them are billable. So what we're hearing is basically $500 comes back to the rescue squad. That's an average. Please, again, internet, I know you're going to go, dentist said we get 500. That's about the number we're hearing. So 500 times, this has been talked about. 500 times 175 doesn't get anywhere near that $875,000 of staffing. Okay. If we went to a paid staff.
If we were a government office, not a private corporation like Lambertville.
Well, let's just say all the stars aligned in Amwell Valley said we can get 2 EMTs, we can pass this certification, whatever that is, and we're going to be now existence. We're going to start billing. They couldn't generate enough money, not even close, to cover the cost of what it would be to staff that station. It would seem like a simple answer. We'll just upgrade and start billing and hire people. Hiring people is again about $1 million, right? Because you got capital expenses. I'm just talking about the 875 being the salary. So they're going to fall short hundreds of thousands of dollars. That money still has to come from somewhere. And if that model were to exist, that money would come from all of us out of tax revenue. That's just not sustainable.
Okay.
But it is a good question. It's been talked about. Keep in mind, a lot of residents are new, like, oh my God, where did this come from? This has been talked about for a long time. Now, I try to be as transparent as possible by putting stuff through our Facebook page. It's got pros and cons. As soon as I put it out there, some bizarre comments get made that are very frustrating that we don't go on and correct. Yeah. All right, but that's one of the easiest ways, I think, to reach people. It's hard to reach people from the township government. Like, we can't mail letters home because it costs thousands of dollars to mail a letter to every house. And who even opens their mail anymore?
There you go.
Right. A lot of people don't open mail. So I heard your question slightly different. I hope I answered it. I don't know if that's what you were looking for.
All right, I had one last thing, and if you will accommodate me, I'm retired military, and I get a small benefit on my taxes. Is there such an avenue that we could actually have an incentive for the residents? You want to be part of our ambulance corps? We can give you a property tax relief, an incentive as a means to get individuals to volunteer?
That's very hard to do. So when I was a police officer in Raritan Township, lived in Raritan Township in the beginning of my career, they passed an ordinance that waived permit fees for volunteers, first responders, firemen, and rescue squad members, folks that volunteer for different agencies. So how often does somebody engage in the government where they may waive a $50 fee? That's probably the best we could do at this level, is have an incentive where we could talk about an ordinance to waive those fees, but I don't think it's going to be enough to have dozens of people come running out and volunteer.
And Bob, the other thing is the critical staffing need are EMTs. So it's not just like somebody can, volunteer and then you'd be able to send out more vehicles. It's a medical degree with lots of training and lots of hours, and so it makes it certifications and up certifications. And so it makes it, unfortunately, these days a difficult thing to arrive at, which is why, again, the volunteer model is difficult. And even with township chipping in money, That's why everybody's gone away from it in the last, whatever, 10 years or so, because it, as one of the commenters mentioned today, one of the residents, the model just can't work, I think, for the volunteer model, as unfortunate as that may be for us.
So I would also say the initial training's many hours, and then there's, I think were you an airline pilot in your career? Is that, did you have to continue in ed every year? You had to do some, they have to do the same. And on top of volunteering, they also have to do that on their time. So it's a very hard model to sustain. I've often said this over the years. I wish we can roll the clock back to 1985.
Yeah.
It's just a different time, and that's just the reality. We're one of the last towns, again, to my knowledge, in Hunterdon County that doesn't already have a billable agency as their primary responder. There are 2 or 3 left. These guys would probably know more. Am I accurate on that? 2 or 3 left that aren't a billable agency? That's primary coverage. Is most of Hunterdon County is now covered by a billable agency, right? With a few left. People have tried to bring in ambulance services. So we can call the hospital in Trenton and say, hey, can we hire an ambulance? That's about $600,000 for Monday through Friday coverage during business hours. That's all been talked about, all been thought about. If money wasn't an option, we'd have an ambulance in every corner.
Sure.
You know, but it's just money's always part of it.
It's gonna be
You know, so for this number that we're talking about, we're gonna get reliable. I know it's not. We say professional service, Rob. It's not putting down the volunteers.
I just had to bring it up.
I know, and I know that's always been a rub with the squad. It's not
We all do the
that.
same thing.
It's not. It's professional service, meaning they're running a business. They're running an organization that when the bell goes off, there's somebody there. All right. And this has all been about, we tried this, keeping this together while Amwell Valley, again, tried to rebuild and rebuild and rebuild for years. And we were paying per call and different things like that. The partner said that's not sustainable for them. And it never really was. And everybody knows it was a temporary solution to give Amwell Valley some time. And I think they're admirable. They did the best they can.
Oh, I agree with the gentleman from Lindbergh Road. It's not a sustainable business model. I agree.
Yeah. It's just not. And for folks, we had folks come in and say, we should go out and knock on doors and recruit people. Well, I don't want to drag somebody out of the living room. If they want to be an EMT, they should have the passion for that and do it themselves. Like, I don't want that person that I had to drag in there to do it. So we need people that want to do it. And people, you know what? It's hundreds of hours. They should get paid for it. Because it's not it's insurance companies, you know, that are paying the bill. And most people have insurance. Or they have a Medicaid or some kind of social service system, some kind of supplement. And I think that's just the reality where we are. I put in my letter, this is, guys laugh at me. I drop my son off every morning for football practice, and the student athletes wear a shirt that says, all progress starts with the truth, right? And this is where we are. This is a truth moment. Where are we going in East Amwell? We're in a fork in the road. If Kevin Schneider and his crew walk out of here tonight and say, you know what, dude, we have enough of our own problems in East Amwell, in Lambertville, we ain't coming up there as a first due or what they call a dual alert system. He has the right to do that. Nothing can stop him from doing that. If we contract with him, he's going to be other than his other area, he's going to staff and prepare to cover for East Amwell. And that, I think, is the best route right now. We just don't have another option.
I apologize for
You're fine.
I think if I hear our own chief, it's a gut punch. We will be destroying his legitimacy. He won't be able to get volunteers to volunteer to be a part of what?
Well, and that's why we gave,
Right.
but that's why we gave it so many years to give them a chance, because we had this combo
Thank
3
you.
years ago, right? So, thank you for your thoughts.
I honestly appreciate all the residents coming out and sitting and listening. For us up here, this is a conversation we've been having with the professionals or our mutual aid partners for years. And it's finally come to a head where we can no longer kick the can down the road, as some would say. Yeah. I'm sorry. Go ahead.
Cut you off. Just
I'm sorry. I forgot the nice lady. She did raise her hand, and I told her I would call on her. I'm sorry.
I'm just going to add just to the last conversation,
Go
just
ahead.
just some points, just a couple of highlight points. First, EMS ambulance service is not considered essential in the state, which is why this funding model is such a huge discussion. So that's no matter what organization you run, the state says whatever. They're working on changing that, but they haven't. Secondly, the The difference in our organization is that we can bill, we have to be registered and licensed with the state of New Jersey Department of Health. It's the state, so you know what that comes with. So there's expense, there's licensure. In their rules, we have to have the 2 EMTs. That allows us the ability to bill. The volunteer squad runs under First Aid Council, and they're allowed to do 1 EMT and a driver. So that's a difference. As far as certification, everybody's an EMT is an EMT no matter where you ride at. Some ride both, obviously. That's all. I just wanted to share the clarification.
Thank you. Yeah, appreciate that.
Sorry to cut you off there.
Ma'am, I'm sorry. I knew you had your hand up.
That's
and
all
I
right.
got sidetracked.
I'll come back again if you call me a nice lady. I'm Susan Lax, 50 Van Luz Road. I'm here representing my own views, and I'm going to ask questions after my statement. Regarding this proposal as a member of many of the township's demographics. I am a resident, I'm a voter, I'm a farm owner, equestrian, and part of the aging community. Most recently, I retired as CEO of Hunterdon Helpline and became a volunteer EMT in training with Ammo Valley Ambulance Corps, 48. I will not dispute information presented by both the township and the squad. I agree that service must be increased and the reliance on mutual aid decreased. I do not oppose giving Lambertville a contract as primary. I do oppose leaving Amwell out of the equation. A 69-year-old institution that has been serving this community with hardworking, committed, and expert volunteers without charge to residents is not something you toss aside. And whether chances were given in the past, we are talking about now. The township was different 4 years ago, and so was the squad. The effort to increase service in the past few months has been keen. 7 new members have been onboarded, and EMT, driver, and cadet training has been ongoing. 2 new board members have been contributing. Members have been offering more time for shifts as well as assistance with training. New members have already offered their expertise with recruitment and fundraising. Having served for more than 2 decades as the leader of a nonprofit that also relies on volunteers to carry out its mission, I know the ups and downs of recruitment. I also know the unpredictable ins and outs of grant and fundraising. Both are extremely difficult jobs, but not insurmountable. The squad deserves a chance to make a comeback when it is still serving this community. A window of opportunity, just a small little window, would allow it to continue with the hours it can staff while onboarding and training new MTs and drivers. This should not hurt Lambertville in any way, given the contract it will receive. So why would the township object? A lot of information has been bandied about. I'll let you all argue over that. I have some data. More than 20% of our population are seniors. The number rises for federal programs to almost 40%. The farming and equestrian community are part of our economy. 400 volunteer corps still exist in the state, supported by their townships. And I think Hopewell? If I fall off a horse, Amwell will get to my farm more quickly than Lambertville if Amwell is on duty. Seniors don't call 911 because they do not want to be billed hard or soft, and that's appreciated. Having worked with seniors and county dispatch, the request for wellness calls when someone has fallen or experiencing cardiac arrest, I know that the mere threat of a bill, the mere threat, takes precedence over health care. I became a volunteer with the squad to serve my township, not someone else's. Again, knowing how difficult volunteer recruitment can be, why look a gift horse in the mouth? Encourage it. Don't shut it down. Open that window. And I do have solutions, and I really think that there's hardly any difference between giving them a contract as primary, letting us continue to serve. I know OEM, Braden, all those guys well. If it is on the board that we're only servicing Monday, Tuesday, Wednesday, most Saturdays, Lambertville knows that, dispatch knows that. Let us keep those slots. Give us the opportunity, give me the opportunity to complete my course and become an EMT.
You cannot imagine what goes on in that squad. I'm not going to give you emotional stuff. I'm going to give you reality. Don't shut down an organization that's already working for you free. Free. If you got mutual aid before, now you get your contract, and I realize that's consistent. You don't have to worry about who's on when, etc. And you can do your schedule. But you can also do your schedule knowing that we're going to provide at least 4 days of coverage until we work ourselves up. And I think that's a feather in your cap. I think that's an obvious go-to. Should it be the fair? Should it be, what am I doing Saturday? Thank you. These are things you don't want to give up in your community. And why not have residents serve residents? And believe me, I know about volunteer recruitment. I know it's hard, but it's doable. The other thing I want to know is, have you ever done a needs assessment? Because most grants go out. There's a needs assessment attached. There's also qualifications. So you just gave a donation with the $25,000? Is that correct?
Correct.
Okay. So these grants that usually come from the county, because I served Hunterdon and I served a lot of outlying counties as well, also have stipulations. For instance, if we gave you $100,000 or the grant was for $100,000, we would give you 75 and you would have to have skin in the game with $25,000. Is that in this contract at all?
I'll let you finish and then we'll answer the questions.
Okay.
Is that
What I'm saying is there are solutions. There's ways of getting people involved. There's ways of getting people to volunteer. We have an issue with a lot of college kids wanting to volunteer. There's solutions to keeping them on board. The hospital pays for home health aides and their training, and they are required to stay on for another year. So a volunteer organization is not necessarily a thing of the past, but you do have to have a different business model. People think nonprofits are not business, are not corporations. They are. Okay, the only difference is the board members can profit. So there's a lot of different solutions that could happen, make you look good with everybody who's been here, pros and cons. But seriously, give these folks who I'm just amazed, the opportunity to continue to work and then fill in. I loved your question. Fill in for some of the things that a high-powered, incredible organization like Lambertville, New Hope can't do, because they're going to be stretched. There's no issue with that. Everybody knows that. And we don't know what's going to happen next year, so why not give it a chance this year? Why not let them continue to do the things they're doing now? Because there is an unknown. There's always an unknown. And every contract I had with Hunterdon County, they could bail in 30 days just because they didn't have the money, whether or not we were performing or not. I also know most of the nonprofits in Hunterdon County, and they've had their ups and downs too. And Hunterdon County would be worse off if they didn't rise up again. So I really ask you to consider that. I'm not asking you to take Lambertville off the table. I'm just asking you to leave that partnership in place, because you never know. You never know when you might want to call the squad and say, hey, we have a problem. I've taken a lot of courses with OEM. If there's a disaster in this county, and there was one with COVID, and we were the only nonprofit that was open during that time, and Braden called me up and said, you got to shop for these quarantined people. You've got to do this, you've got to do that. We never got money. Never got money. We still fulfilled our mission. But you never know when a crisis like that might happen, and you will pat yourself on the back that Rob and his crew come to answer the call, as small as we are.
So we have a 5-minute time limit. Do you have more to add? Because I want to start answering your questions.
I think I've said enough, because I'm a nice lady.
Thank you. All right. Susan, I appreciate all your comments and everything you had to add. I took some notes when you were talking. Let me try to answer these step by step. Okay. So keeping Amwell Valley supported in having them handle the 3 days a week that they're currently handling. They need money to stay in business. They needed about $110,000. They've asked us for that money. Are you suggesting that we give them the $110,000? Well, that's a rhetorical question. I don't need an answer. So we would have to give them thousands of dollars to keep the lights on, to pay for that 3 nights a week. When it comes to grants, so we've supported them in the county. The county just put out a request for grants. We've supported that. And in fact, I also made a phone call. So what I've done this year is called the governor's office. No luck. They're not giving out any money. They got enough of their own problems. Shirley Turner's office did release a grant to us for $50,000 that we'll be getting in the fall for emergency services. I did tell the squad that, but that's going to be up to us now where it goes. If we go with Lambertville. All right. Your personal preference is only to serve East Stanwell, but others, it sounded like even from listening to Rob, most of their members aren't even living in East Stanwell. Is that correct? 18 out of 50? So people tend to serve other communities. I understand your need to want to serve East Stanwell, but the biggest question is who's going to pay to keep East Stanwell open while they continue to rebuild, because we've been rebuilding now for over a decade.
Well, it's a two-part problem. Volunteers are obviously the biggest problem. Not afraid of raising money, and we've had the new folks come on board with great new ideas in terms of fundraising. The problem is, and I think Rob said this, why did I bother to do this? If you're shutting us down, if my own township won't support me as a volunteer, if they read things on Facebook that I've been reading, why would they answer the door? Why would they answer the door? So I think that volunteerism is surmountable. I know we can do it. I've done it. Okay. And I know the fundraising as well. There's different models with fundraising now. There's also different models where you don't have to put somebody on payroll. Some call it 1099. There's so many different things that we could possibly look into. What I'm asking you is for time to keep that service in place, however small it is, so that we can look at those solutions. All I keep hearing is it wasn't solutions. 4 years of trying. Granted, that was wonderful. It didn't work, okay, so you move on to the next solution. But I've seen it happen firsthand. I've worked with government before, and there is opportunity here if you would allow it. And there's no reason why you couldn't let them continue to work for the 3-4 days that they're working now while we build it up, while we see it's possible. You want to put a time limit on it?
All right. I think, yeah, so we're going over the same thing again. So I thank you for your comments, and we'll consider what you said. Go ahead.
I'm sorry, I know but I think what Susan's point is making Lambertville primary and Amwell Valley secondary.
Well, I think that's what's happening.
So explain that the township, we can't determine who's secondary. And I'm not trying to put Kevin on the spot right now, but if we award the primary to Kevin, Kevin is the one that would determine who is secondary or anything after that. That is I'm understanding this correctly, right? The township has no say in the secondary part. So I hear the point, Susan. We just can't determine who's secondary. That's all going to be if this goes to Kevin, it's all going to be in Kevin's hands.
Yeah, and we've already spent. I've spent 3 years already, giving opportunities. So I think at this point we have to move forward in some way, even if as Patrick mentioned in his comment, we can look at options next year and the next year and the next year. But for now, we need reliable service. We need it 100%. So I think we need to decide whether we're taking action today to introduce an ordinance.
Any further comment from folks that are here? Do you folks have anything else to add? All right.
I'm just going to follow up on something too.
Yeah, go
Is
ahead,
that
go ahead.
no? To your point about the property taxes, that's property taxes are governed by state law, so the township committee can't give any reduction or anything like that unless the state law allows us to do that. So I'm not aware of anything that allows that for rescue squad or EMT stuff.
No, not that I am. Like I said, the best I've seen is waiving some permit fees in surrounding towns, but I'm not even sure if they're doing that. It does seem like a good solution, right? Okay, volunteer and you get X amount of % off your property taxes, but I don't believe we have the, and Frank, you can weigh in on that. We don't have the authority to even offer anything like that. Yeah. Yeah, I know there's like veterans, disabled veteran things, but that's all regulated by the state. All right. Does anybody else want to add to this conversation before I close this section for public comment? Go ahead, and then I'll get to you, sir, in the back.
Hi, my name is Bree.
Hi.
I have two
Just
things.
tell us where you live, town.
Backbrook Road.
Oh, that's fine. Okay.
I have two things, and I'm not sure if you can answer them or not, but they're just questions in my head.
Go ahead.
You said that Flemington on what is it, June or July 30th? I forget which month.
As of June 1st.
June
is We
1st.
were notified they were no longer going to respond consistently for mutual aid.
So is that like they're completely done, like they're out of it? Like, is there a reason behind that, or is that just like them pulling out, being like, we're done, totally, like don't ask for our help?
Well, so I covered that, and I don't want to speak for them, but the reason they gave us is they were no longer the business model of them expecting to continue to pick up Amwell's calls was not working for them. Again, these agencies have to staff and plan for the amount of calls they're going to have.
Is it any chance possible for like Amwell and then having the backup of Lambertville and Hopewell or New Hope and Flemington, or they're just no? Okay.
Not anymore.
Okay. That answers
Yeah.
that question.
So just to be clear, like we can't force a neighboring town to come
Yeah,
help
no,
us.
of course.
And to be fair, they've done it well for decades.
Yep.
You know, and again, more than picking up overflow. And this is the fork in the road we're at, and it's a difficult fork in the road. You've listened for, well, we're here 2 hours now, and it's emotional and it's hard, and there's misinformation and disinformation, but the facts are this. What are we going to do if Kevin says we're no longer coming to help you guys?
Yep.
These are nice people. These aren't Texas oil men and New York City attorneys. They're not here to be killers. Sorry, I don't know what other example to use. They're good people. They want to help, but it has to work for them.
Yeah.
So by having Amwell Valley like be staffed, not staffed, okay, we're going to show up here and there, it doesn't work for the neighbors, and that's the problem.
Yep.
And you know, I don't know what else to say on it because this is something that we've been looking at, and we've talked about, I don't know how many different solutions, and they seem to go nowhere. And this is a solid solution that's affordable and sustainable, and also offers an opportunity to do all these things Amwell Valley wants to do, but underneath the umbrella of Lambertville. And so if I have a disconnect where I'm at right now, I'm not quite understanding why Amwell Valley doesn't want to do that. That's the only disconnect I have.
Gotcha.
We're all this audience of X amount of people that nobody hears thinks that an all volunteer, no revenue source rescue squad is sustainable anymore. It's just not happening. I mean, Pennington folded up about a year and a half ago. It was a very big rescue squad, only 5 or 10 minutes down the road. It happened overnight. Hopewell's already using paid ambulance service during the daytime.
Mhm.
Kingwood tried an ambulance service out of a hospital. Lambertville's already covering all the towns in the South County. Flemington's covering most of the towns on this side of 78 in the northern part of the county until you pick up Clinton, which merged, and now they're called, somebody corrected me on this and I'll say it again, is it South Branch or it's South Branch, because I got corrected on that. They're already covering a huge part of that area. So this is not uncommon throughout the county. We're just held on longer than most. And if there was a way to make it hold on longer, we're not putting them out of business, but they are going to need a revenue stream
Mhm.
because the cost of their insurances, the cost of the electricity, the cost of the repairs and maintenance is still going to be the same. So the question would be, is the township going to put in that $100,000 for them to handle 3 nights a week while they continue to try to come up with different solutions? That's not likely because that's not smart financially.
Yeah.
When they can do the same thing underneath Amwell's umbrella in their building. I don't know how much it costs us to keep the lights on in the building. If they still own it, the township's willing to talk about that and say, look, if it's just a matter of the bills of the electric and the gas, we can talk about that. I don't know what other costs there are, because all the other fixed costs are going to be transferred to Lambertville, like the workers' comp, whatever EMT insurance is, and the maintenance of the vehicles. So if it's just a matter of keeping the lights on, we certainly were willing to talk about that. That doesn't sound like a lot of money to generate, but again, I don't have any facts in front of me. But you had a good question.
And then my last thing, I don't know if this is directed toward you guys or to the volunteers, but like talking about like the fair, do they have like, oh, what are the words? What's the word we just used? Thank you. Like at the fair, would there like, are there recruitment like tents like to try and like, and not even just like at the fair, like are there any like you know, like
Recruiting drives, lawn
Yes,
signs.
thank you.
They've been doing all that.
okay,
So
I'm just unaware of so I'm just
here's I'll be clear on my issue with the fair. The fair is a non-issue to me. That's a business. You ever go to the fair?
Yes, I
How
love
much
it.
they charge the park?
20?
10
10
at least.
Yeah.
How much is a roast beef sandwich?
10.
The fair,
Yeah.
The fair 15.
Yeah.
The fair pays tens of thousands of dollars in overtime for police officers, and they don't bat an eye about it. They certainly can pay for a Lambertville ambulance to sit there during the daytime. So the fair, and first of all, most of the people at the fair are not East Amwell residents.
Yeah.
So we're volunteering tens of hundreds of hours for a business that's charging people. Every time I go, I spend $300, and I go every day. I have a daughter and a son who think that we have a money tree. All right, so that's a non-starter to me. The fair does not need free ambulance coverage.
No, that wasn't my thing. I was just, wondering about like if we had like, booths to try and like get people to become volunteers.
Yeah, it's out there. I've seen it. Yep.
Yeah, because I'm unaware. That's why I'm just, asking questions that probably have already been answered. But that was it. So thank you.
Thank you.
Thank you.
Mike, I
All
have to
good
go.
questions.
I have to go, but I know you have a
Okay. Yep. You're done?
Yeah.
Okay.
I have to go. Sorry.
Go ahead.
9 o'clock. I can't stay on.
All right, thank you.
I'm the nice lady's husband.
Thank you. The nice gentleman then.
So if there are 300 to 400 volunteer EMS services in the state, has this group done anything to mobilize with them to get the state to enforce mutual aid agreements? Because it's really the folks at the state level that could mandate that. Obviously you can't, but there's an awful lot of rural areas that have volunteer coverage that would be highly motivated to join forces to create such a law at the state level.
So what I know about that, and I don't have all the details, there is some kind of law making its way through the state now that is talking about requiring EMS services to be an essential service in a town like police and fire. Right now it's not passed. I don't even know where it is in the legislature. But so what I would say to that is the governing body, it's not necessarily our responsibility to go out and recruit these people. Amwell Valley could and should have been and maybe was talking to all the partners in the area about joining forces. I am not aware of any meaningful progress in that, but they can answer that. So I'm not going to go out and talk to 5 different towns and say, hey, will you join forces with Amwell Valley? They're their own entity.
I'm not talking about them joining with Amwell Valley. I'm talking about bringing legislation forward at the state level, representing all of the rural parts of the state, which is most of it.
Right.
All of whom have a vested interest in exactly the same issues that you're challenged with now.
So good question. I did quote. So when you're the mayor of a town, you get a direct liaison to the governor's office. I've talked to him several times. He runs it up the flagpole. I never hear anything back. And that's great idea, and we'll look at that. But right now we have an immediate need to solve a problem. Waiting for the state to fix it is, I don't know.
Well, with all due respect, you've had an immediate need for 4 years that apparently hasn't been addressed with regards to this type of challenge, right?
So with all due respect, we have been addressing it, and now our partners, it no longer works for them. That's why we're addressing it now.
Now, unless these guys pull the rug out from underneath you, you do still have an ongoing solution.
I mean, after all, 20% of the hours are covered by the volunteers at the moment. And that's at the low point, right? So there's 168 hours in a week. They're covering 36. That's 20%. If they were to up that to 30 or 40%, I'm not sure I understand what the problem is with regards to the Lambertville folks handling the other 60 to 70%. After all, while you said it's difficult to schedule, not really, because it's not as if these guys decide randomly when to go in and to staff. They have set schedules. Those schedules could very easily be coordinated. I don't think it would be especially difficult to say whatever 36 hours they're covering at the moment or 50 hours next month that they're covering. I don't think it's really difficult for him to pick up a call and to call Kevin, is it? And to say, hey, Thursday night, you don't have to worry about us for the next 6 months. I'm not saying, obviously, he's not going to do it on a day-by-day or week-by-week basis. And with regards to the primary, secondary issue, if you are writing the contract and assigning it, I can't imagine that you can't actually stipulate in the contract who would be secondary, as that would be a negotiating point along with everything else. Along with the price you pay and what you expect for in terms of services, that's just another negotiating point in contracting. And if I heard you correctly, early on you said that the response time from Amwell was about 11:15, and I thought you said that the response time from Lambertville was about 13:45. Was that correct?
13:53 and 11:12.
Okay, so that's 3.5 minutes, 2.5 minutes. For someone who has a cardiac arrest, every minute represents about a 7% decrease in the likelihood of survival. Now, obviously, they answer a lot of calls that aren't for heart attacks. But the reality is that if one of you have a heart attack right now, your chance of survival will be diminished by close to 20%. Not because they're doing a bad job, but just because they're 2.5 minutes later.
Thank you for that.
Thank you.
You have anything on that? Other than
I mean, it's what I've just been saying repeatedly. If response time is, if we assign Lambertville as the primary and your concern is response time, you should be concerned about response time now because Lambertville is responding to most of the calls in East Amwell.
That's not the point. The point is that for those 36 or 44% of the calls that can be answered by Amwell Valley,
Amwell's responding to 8 calls in June. 8%.
They cover 20% of the hours.
That's fine. It was 8% of the calls that they responded to.
And is that typical, 8%? Is
No,
that
like I said, that was just the past 2 months since we increased our hours.
just the past 2 months?
Before that, we were 50%.
Don't get me wrong. You're right. 1345 will be a concern. All I'm asking you is that if in the event it's your heart that goes out, would you prefer it to be 11:15 or 13:45?
I would prefer.
If you would prefer 13:45, good luck.
I would prefer that I know somebody's going to respond.
But they're going to respond.
I'm not. I mean, you can't go.
If during the assigned hours, I'm not suggesting you do this as a lottery, just to see who randomly picks up the phone and gets in their car and rushes over to your house. During the 36 hours that they staff, they're going to answer.
So
during the other 132 hours they don't staff, they answer.
That's Lambertville's not willing to do that anymore, and that's a discussion to have with them if we award them the primary contract. They're not willing to work as that as mutual aid anymore.
So, but just to be clear, and we've answered this many, many times even tonight, somebody still has to fund Amwell Valley to work those 3 nights. They still need $110,000 to stay in business. All right. They're asking for that money from us. All right. From the township, from the taxpayers.
Have you been paying that year after year?
No, we
Okay.
have not. No, but they're asking for that money now from the township to stay in business. Because once Lambertville becomes the primary, they're going to get less and less donations. So they're going to have to rely on more and more from the township. Now, the solution to this is, and I've said it multiple times tonight, the 3 to 5 really active EMTs from Amwell Valley can sit at Amwell Valley Station as a volunteer through Lambertville if they join. They pick up a Lambertville truck, Lambertville T-shirt, go sit there those 3 nights. If that so fits Kevin's business model, that solves your problem and it takes some stress off of his staffing. So why would we pay to keep Amwell Valley open, right? The 110,000 or whatever they need. They can still fundraise behind the scenes and get all the volunteer hours. Like I think Susan's your wife, right? If I got that correct, that she's
You did.
suggesting. And I have no doubt that she probably has a lot of experience in this. But we have an immediate need now. And this has been going on for a decade. I am sorry that it's just come on your radar recently, but this has been going on for a decade. Our partners are no longer willing to operate underneath this model. Right? One's already pulled out. That created the urgency to get this going. So what we did when this hybrid quasi pay-per-call was going on, we agreed to fund them. Right? There's in the funding. I don't want to get into why they weren't funded. This has all been hashed out in a room just like this in front of dozens of people with back and forth disputes and this difference of opinions. We've already hashed that out, and we've come to terms that if they do X, we'll do Y. All right. We've held up our end of the bargain and started funding them. All right. I also applied for a grant, what they would have needed if they continue to service. But all in this amount of time, one of our partners dropped out completely. The other one has told us this no longer works for us. We're only prolonging the inevitable. I understand why folks want to continue to keep it as a volunteer service, and they're very proud of what they're doing. But they can do the exact same thing wearing somebody else's T-shirt, and that is still where I have the disconnect.
I haven't heard them, well, maybe I misheard. I did not hear them say it's all or nothing. I mean, if it is, that's because they hold the cards, they could do that. But I didn't hear them say it's all or nothing, and that if you don't give them everything, they ain't going to play. They're still going to bill for the calls they make during the other 132 hours that they cover. They're still going to receive the same reimbursements for those 132 hours. It's not as if their business model is threatened.
So to be clear, because I spoke to Susan earlier today too. We had a meeting with Mike and I had a meeting with the Lambertville people in charge, for lack of a better word, and also from the Amwell Valley Board of Directors. And Lambertville told us at that point that they can no longer sustain the mutual aid system under this current model. So that's when we had to start deciding what we needed to do to make sure East Amwell had 24/7 coverage. So that's what made us have to look into this. It's not that we suggested it and then Lambertville backed out. It was Lambertville saying we cannot sustain this covering 50 to 80% of your calls anymore.
And the reason for that? If you have the billing model in place that you have?
So that takes a lot of resources out of our other municipalities. That's the first problem. So now we've gained a whole new gamut of calls that are outside of our local. So that becomes a staffing issue and concern. And I also have a lot of pressure from my locals as to why you're doing that.
So why would you do this?
Because this is a model that we can sustainable. For me, it's trying to be sustainability for organization long run, because the costs are continuing to escalate. We need to have income to pay for our staff and to grow that staff and to continue our business model.
But the business model hinges largely upon billing the recipients of the service.
There's not enough call volume to warrant there's not that much income from the call volume. It's only 300 calls. So if we're on, we won't even say, I guess we'll say dual alert, I guess is back up at the term where it is now. If animals not staffed, that we have to come, then we have to be proactive and work towards that solution.
I'm not sure I at all understand the math there. If it's only, as you put it, only 300 calls, you can staff for that knowing exactly what hours you would need to cover and bill for that, get some money from these folks. And I don't understand what the problem there is if they're taking 20% of the hours.
So I'm just, we do have a time limit and I've been very generous, but let me try to clear that. He needs all the calls for service in East Amwell to make the business model work. If we start cutting days out, it no longer works.
I find that very difficult to compute.
I'm sorry you do.
Because, you know, I don't, it's not as if you have, it's not as if it affects your fixed costs. It's purely a variable cost item. You know what the variable costs are. You know the hours you need to cover. I find that highly suspect, but I'm not your accountant.
All right.
Motion to close?
I have one hand up.
Oh,
Come on
sorry.
up, ma'am.
Kim Geis, Mountain Road.
Thank you.
I want to quote a movie. I think what we have here is a failure to communicate, because what happened is most of these people are just hearing about this now. You're saying it's been 10 years. I found out in December and started attending the meetings because I was interested. This is something that I've always helped with, the rescue squads, or volunteered with a lot of things. But I think it's a communication issue. We really didn't, we being the township, didn't communicate enough to everyone in the township saying, we have a problem. And putting it maybe in the VIP, putting it on Facebook, there is so much missed, because when you get the VIP, maybe you got to read at that time, maybe you didn't. When you go through Facebook, I don't know how they get it out there, but you don't get to see everything. You know, for some reason, it's like, well, where's this person? You don't know where it is. So there's a lot of things, our lack of communication anymore. And you say it's very expensive to mail. Yes, it is. But maybe there should be some kind of mass mailing on certain issues. I don't know what the answer is, but it's disturbing when people find things out so suddenly. And I think that's really what's happened here.
So let me ask you, how did you find out about it now?
In December,
Okay.
I was reading something and I'm like, they're going away? I just gave a donation. Well, why did they go away? Yeah, I'm like,
okay.
So I came to a meeting. And that's how I found out. That was December. That's not that long ago.
So I appreciate the comment and totally agree that communication is the challenge. Here's what we do. We talk about things openly. There is a text message and email system that you can sign up for on the township website. We put that in, I believe it's in every meeting minutes that we do. It's out there. Residents can go to our website, sign up for this. We put it out there, what we're talking about.
Yeah, I guess you have to join, because I tried to do something and I didn't
we
get
can
in there.
help you with that. And yes, I agree. The communication is very hard. All right.
And us older people don't even like any of that stuff.
I know but it's hard, right? So, as mayor, I decided in last year, Dante, when he was still mayor, empowered me to start communicating through our social media page. Last year at this time, I had a full head of hair, believe it or not, before I started going on social media. All right. That is not a world that I'm familiar with. It is there's people like waiting to get you as soon as you put something out there. It's a weird thing. So, but I'm trying. It's despite all the problems with it, I'm trying the best I can to put this out there. I know when I post stuff, it's going to generate a lot of anxiety and a lot of questions and a lot of concerns. I try to communicate the best that I can through there, but I can't get into a social media argument with people over their version of opinion. So we try the best we can. Your statement is valid. Communication's hard, but sign up for the text message system. Sign up for the email system. Follow the township's Facebook page. I know Instagram is a thing for the younger people, but I'm past. I don't know how to do that. I follow my son and his friends, but that's all I know right now. Maybe somebody can help me with that. Are you into Instagram? Okay, so we're not even on Instagram. All right. VIP, we post letters. I have been talking about this over the years in the VIP, and we talk about it here. So it's usually when it's going to be a discussion item, it goes underneath on the agenda as a discussion item, special discussion, things like that. So we try the best we can to get it out there, and I think we're doing a decent job, but it's hard. It's still hard. There are folks, like plenty of people, that miss it.
Right.
It's-
There's many people that are missing
Yeah.
because some people
But
don't.
if somebody can offer me
don't
a
do that.
suggestion to better communicate, I'd be happy to do it. Social media, that's a two-edged sword because it generates
It's
some
not good.
wacky stuff, but it also gets information out there.
Mhm.
All right. I did, go ahead, Bob, one more time, and I'm going to try to turn the page.
A solution for your communication, we have the tax coming up for August. If that's not mailed yet, put a letter from the mayor in when the new tax bills.
We do have one going out this year, but thank you for that. That is a way to take advantage of something we're already paying for. To get that thing is stuffed with so much stuff if you ever see it now, but it's hard. I totally agree with you, and we're trying. Seems like social media seems to reach a lot of people. Jenna laughed at me because I said we doubled our followers in 1 year. I don't know if that's good or bad, but just people following us from. I got
I don't
people
even
from
know
out
what
of
a
the country
follow
now
is,
following
so-
us.
Oh, good.
So, all right. So, thank you for the comment, though.
Thank you.
All right. Any other comments on this? I mean, this is a lot to digest, a lot to talk about. But since we talk about this a lot, this still leaves me with what is the other alternative, right? That's where I find myself here. And I don't hear one that's going to be workable and affordable. So if there's no other comments from the public, we're at the point of the meeting where I'd like to close the public comment section.
Second.
I have to read this little thing now.
Oh, okay.
Seeing there are no further comments, I would like to close the meeting to the public without objection. That's on this section only. We're not closing the meeting yet. I know Linda probably wants to go, but all right. If whoever has the agenda in front of them, I'm up to number 6. All right. That is ordinance 26-17, first reading and introduction. Linda, will you please read by title?
An ordinance authorizing and designating the Lambertville New Hope Ambulance and Rescue Squad provide ambulance services to the Township of East Amwell, County of Hunterdon, State of New Jersey.
All right. Explanation. I think I've explained it. So, I mean, I don't know what more I can add than you've heard from all these folks. All right. So, do you have a party? Can I please have a motion to introduce ordinance number 26-17 with a public hearing date of August 13th, 2026?
So moved.
Second.
First Bev, then Al. All in favor?
Aye.
Aye. Need a reading or no?
Nope.
Okay. We're up to item number 7. Motion to approve resolution 2615 as filed in the office of the township clerk. Can I please have a motion to approve resolution 20?
Before you do that, we need to know which one you're deciding on.
Okay, so this is another conversation. All right, so folks, bear with us. If the rescue squad folks, if you want to go, I appreciate you, Lambertville, you can go. I don't think we're not talking anything rescue squad from here on out. Unless you want to talk to me about rocks for the tennis court, you can stay. If you want to talk about which rocks I should put at the tennis court base, you're welcome to stay. Thank you. We'll continue our conversation. Thank you. Thank you. That's kind.
Thanks, Rob.
All right. So, who wants to hear about the rocks? Nobody? Huh? Nobody wants to help me decide what rocks to put in the tennis courts? All right. Thank you. I'm going to talk to myself then for now. All right. So, folks that are, I'm talking to you guys.
No idea.
All right. So, for the folks that know, we are obviously building new tennis courts, and an issue arose with the base of the tennis courts. There is some wet spots in the tennis court base. Mostly, in fact, not mostly, all where the old net used to be and the footings for the net. Over the years, there's cracks and things like that. The water got down in there and made the underlying dirt, clay, I'm told it is, soft. So when they did let's call it a stress test, I guess, they drive an 80,000 pound dump truck full of stuff with tennis feathers. Is 80,000 pounds of feathers covered in rocks? Yeah. The 80,000 pound triaxle dump truck, and they drive it across the whole base, and where the net was, it's dipped 6 inches to 18 inches when the truck went over. Pretty consistently, right? And I'm waving my hand like you guys, that matters here. Pretty consistently where the net ran. All right, the rest of it was solid. So the solution for that is they have to dig that out, and put new base in. There are two choices. Well, they recommended one, and I asked for more economical version just so we have something to compare it to. And I do have are the numbers here, Linda, or no?
The numbers are on each resolution.
Okay. So one of the resolutions is going to have a number of like 19,000 and change, and I'll put that number on the record as soon as I find the resolution. That is to use a substance called crushed concrete. So they'll dig out the wet and backfill it with crushed concrete and make it all whatever they do to make it compact. And the other is to use what they call crushed stone, I guess. Something you would put in your driveway, not clean stone. It's the stone that looks like little stones, but it's like mixed in with like stuff, I guess, for lack of better wording. Anybody's driveway that's the base for it. That is like closer to $25,000.
One, I'm sorry, just to
ahead. Yeah,
interrupt.
but-
One's 19,903 and one's 24,971. Those are the two
so
numbers. 903, so almost 20.
20, okay.
And then 24,971, so almost 25. You're
All right, so it's like roughly 20 and 25, but Jenna put that number on the record. One is using, I don't want to call it dirty stone because that's not what they have. There's a name for it. Concrete.
Did our professionals recommend one over the
Yes,
other, Mike?
she's trying to. This is our way of saying get over it. All right, so the tennis court people recommend the stone, not the crushed concrete. They say it compacts better, it's stronger. Jason was there with me for the stress test, and he saw what was going on. He also recommends the $25,000 version just because it compacts better. It's a better base. My thought process is to go with what the professionals recommend. This, for the record, this is not a cost that was included in our original proposal but it's not an unexpected cost either, right? Because yes, go ahead.
They're gonna be driving trucks up there.
It's how they do the base in order to warrant. I agree. All right, I agree. But in order for them to warranty the court, this is their stress
Let's
test.
go with the
Yeah.
All right,
recommended stone.
I make a motion to
This is our way of saying I had enough.
introduce resolution 2026-115.
I can't talk about the stone anymore, everybody. All right, third. Jenna introduces, Al seconds. All right, so we're going with the.
Okay.
Yeah.
It has a number though, right?
It has a
2026-115.
Right. I didn't go in
It's in
there,
your
Linda.
signature folder, and both stones are called different.
Is
One
there a
has an
name?
R,
Should we
it's
put that name on the
RGA or
record?
something, and
DGA undercut.
so we're going with the DGA.
Sounds right. All right, that's recommended by our professionals. She set me up for that.
Okay.
All right.
All in favor?
Aye.
Ms. Casper Bloom?
Yes.
Ms. Enton?
Yes.
Mr. Nardi?
Yes.
Mayor Dennis?
Yes,
I have one more thing.
of course you do.
I don't think we did a roll call on ordinance 2617 introduction.
We don't have to
I
do it
asked.
on
She
We
said
don't do a
didn't.
roll
First
call
reading.
for intros?
No, just.
Okay.
I asked. It's not even
I-
on my sheet, and I asked.
Okay.
All right. All right. So
So moved.
we're done, right? You're gonna do your part. We got the resolution for the
We're all good.
25 and 24 and change. All right. All right. We're up to number 8. This meeting is now back open to the public. Seeing the room empty. Seeing there are no further comments, I would like to close this meeting to the public without objection. Any new business or anything for anybody?
No.
Okay. Item 9, adjournment.
So moved.
Being no. Sorry, guys. It's
Sorry,
been a
I'm
long
gonna-
night.
No, it's okay.
Did you not notice the seat that
still-
I was in compared to you guys? It's been a
Oh,
long night.
absolutely.
There being no further business, I need a motion to adjourn. Motion by
Second.
Bev and Al, all carried unanimously to adjourn at
9:20.